term this? Yes, this na term for all Salone people and them party them. Sierra Leone Media will be bringing you a variety of programs ranging from documentaries to discussions, interviews, news, views, sports and entertainment. Our programs will contain matters on development, governance, the economy and issues that are of importance to Sierra Leone. So, no left BNO because we get Bebe program then like Salone discussion, meets the ministers, the president's hour and the Gladi program, Look Me, I Look You. All this they start soon na www.sierragemedia.org. Now who's term these?
The total population of Sierra Leone in 2019 was stated approximately at 7.8 million. And the most common cancer reported in 2018 was breast cancer, with an incidence rate of 25.1% and a mortality rate of 19.2%. Ward 2 at the Connaught Hospital, Freetown, is a female surgical ward that cares for patients requiring breast surgery, chemotherapy, and palliative care. General surgery also admits to the ward as see fit. The ward is in need of a significant refurbishment and has a major impact on patient assessment and delivery of treatment, dignity, comfort, and infection control measures. The current ward area presents a significant challenge to infection control. There is no fit for purpose or adequate personal hygiene facilities. The showers and sanitary areas are in poor condition and are difficult to clean. The flooring is deteriorated. Overall decor and fabric of the walls need repair and full decoration. Furniture, cupboards, and shelving require replacement. The sluice, known to be the dirty utility room, is in poor condition and needs replacing. Windows need to be replaced as current windows bring in draughts, dust, debris, mosquitoes, and rodents. There is no designated area to provide a day service for patients receiving chemotherapy. Medical supplies is desperately needed. Therefore, we need a total amount of £15,000, which is equivalent to 195 million leones for this project. This project will focus on women diagnosed with breast cancer and other non-malignant breast abnormalities requiring one or more of the treatment modalities that are currently available. We will also set up a day unit for the administration of chemotherapy and provide training and development to ensure sustainability. Therefore, I am pleading to all individuals, organizations, and local businesses, and every Sierra Leonean and friends of Sierra Leone to make a meaningful contribution that will never go in vain. Ways to contribute will be seen at the end of this clip. I am Aissata Sise Jallow of the Health Show Partnership Program. Remember, your health is your wealth.
When I was young, a lot of things were different. Unfortunately, most of the differences seen now are heartbreaking and are not good at all.
Before now, men were strong protectors of the weak, fathers, brothers, lovers, sons. Their mere presence guaranteed the safety of women and children.
But what do we do now?
Men harassing and raping women.
Men sexually abuse little girls.
Men battering and killing their wives.
Any form of sexual assault, be it rape, sexual abuse, or pedophilia, is a killer to human self-esteem.
Women should stop dying in silence.
Speak now.
The rapist should be stigmatized, not the victim.
I think death sentence should be the consequence of such terrible act.
And you mothers, build confidence in your children, put trust in them, listen to them when they make reports, and take necessary actions.
Talking of mothers before now, women were virtuous.
They were mothers, daughters, and sisters.
Nurturing, counseling, supporting their men folks.
But now,
Women are trafficking female children for money.
Women are forced to be silent.
All this must stop, and it must stop now.
Real men do not abuse, rape, or molest women and children. It is barbaric, unacceptable.
let all real men stand with us.
Together, let's say an emphatic no to rape, sexual abuse, pedophilia, and domestic violence.
Hello, my name is Josephine Kamara. I'm the founder of You Can Do It Foundation. You Can Do It Foundation is a charitable organization based in Sierra Leone, West Africa. You Can Do It Foundation has been in existence for the past 2 years. We have been fighting gender-based violence against women and girls within the community. During the past 2 years, we have been offering psychosocial support, counseling, court fee, medical fee, including school items to the survivors of gender-based violence. However, during the lockdown of COVID-19, report received and confirmed that rape cases among a minor has increased tremendously within our community. Because of this, You Can Do It Foundation has secured the land to build an accommodation for the survivors of rape. However, this may almost become impossible without your generous support. We need your help to build this home for the survivors. Your help could be in cash or in kind. If you wish to join us to make a difference in a child's life, please go to our website, which is www.youcandoitcyf.org, or you can go to our GoFundMe page, which is Home of Hope for the survivors of gender-based, or you can contact us with the details at the end of this video. We thank you greatly for your generous support, and thank you once more for making a difference in a child's life.
Nina Yvonne Akisoya, and 11th May 2021 make me 3 years where I don't day in office. I say let I come and tell Fritonians them una boku boku tenki for where una elect me and when I give me this mandate for serve una. But I not just want to tell una tenki for when I elect me, I want to tell una tenki for when I don't work with me and work with the councillors, work with the staff of Freetown City Council, work with so many stakeholders, including the central government, the international partners, the local partners. I want to tell una, the Freetonians, and thank you, but I want to tell all the other groups and the Boku Boku Tenki. Together, we embark on a journey for Transform Freetown, and in nobody not been say it go easy. We published the plan in January 2019, and then in January 2020, we published our first year report, and then in January 2021, we don't publish with 2-year report. Inside the reports and day, you go able for read in much more detail, waiting we don't achieve. But family them, I still I just share today some of the things that really make me heart gladdy pan this walk here. One thing we're really gladdy about, now the wastewater treatment plant where we don't build na King Tom. This is not the first time ever in the history of Salone for let we get the thing we come on with toilet. Instead of it just gonna grow na King Tom, it actually they go into a plant where they get for separate the solid from the liquid and get for treat them and waiting get for come out can go towards manure. It can now be safely the liquid can now safely be disposed into the waterways. Another practical thing we are so glad for now this urban farming project we bring over 300, in fact we start with 300, now we add another 200 women them. We now at them backyard them and in community level, particularly in deprived communities.
I can create this, what you give, the okra they come up, they will plant them.
The women they do farming projects where go benefit them picking them, for get more nutritious food, but it go also help them for get small thing at the hand as then sell them in the market. And then their nursery school. Famble then go no say we been not open the one at Congo Water Market for make vulnerable women them and then young picking it under the age of 5 get free quality preschool care. And now we dip and build the second one. We do refurbishment upstairs in the Croton Road Market, and that facility will be open and available to women and men traders inside Croton Road Market. Tricycles. Well, then tricycle and they not only then they help for keep we city clean, they also they create employment. We don't create so far over 1,200 jobs with young people then where they go and collect dirty na the streets. And now we get 90 more where they come on stream. So I'm so happy because it increased the capacity for collect dirty. At the same time, it increased the number of people them, young people that we get work. Let not talk and not talk about the transfer station. When I did the dirty, then they go. So we don't get 4 additional ones, including the one at Lumley, the one at Approved School, the one at Shell, and the one at Allentown. Bele Uman them. Then they all over the community. That journey for going to PCMH, it can challenge Boko of them. So with the work for upgrade, 5 of we page use them for make them be monk, side with side Bele Uman, the able for born. Freetown people, them Boku people that know say dog na challenge na this city. And so we don't start a program for sterilize, vaccinate the dogs them so that we go get control over dogs and we the ambog motaman, but we the ambog themselves. We go make we city healthier and it go reduce the risk for let people then get us sick with and call rabies. I don't share small about wait we don't do and over these 3 years, but I just touch the thing in Boku. I go say anybody want for no more. Also go now with Facebook page. We get Freetown City Council Facebook page. We also get Yvonne Akisoya, Mayor of Freetown. You go able for follow we. Let we continue for work together with all we stakeholders for let collectively we transform Freetown. Una, thank you and God bless you.
Na Yvonne, Na Yvonne, talk and go, talk and come.
I was raped multiple times by my aunt's boyfriend when I was 6.
I was repeatedly raped at the age of 8 by a close family member.
I was raped at 19. I didn't speak openly about it because I was ashamed and afraid that people would judge me.
I was raped at age 5 by my caregiver's husband.
On June 17th, 2020, 5-year-old Khadija Sakho, a beautiful little girl from Freetown, Sierra Leone, was repeatedly raped and strangled to death, allegedly by her own cousin. Her death shocked the nation. But in truth, in this small West African country, 9 out of 10 girls experience some form of sexual violence in their lifetime. Think about that for a second. 9 out of 10. That's 90%. My name is Aisha Sasay. I'm a journalist and activist. I'm joining forces with Idris Elba and other activists from across Sierra Leone to support the survivors of sexual violence with the Survivors Solidarity Fund. Please consider donating whatever you can afford. All monies raised will go to 4 local organizations currently providing free medical and legal services to survivors. 5-year-old Khadija lost her life to sexual violence. That same threat remains for millions of others. So this is also a call for you to use your voice, your power, to draw attention to an enduring culture of rape. Together, we must end it now. My name is Aisha Sasay. I am Khadija Sako.
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 We are Khadija Sako.
We are all Khadija Sako.
Alright, viewers, good day. And Nina Mohamed Silade with my colleague Wena Ibrahim Saidu Nyandemo. We work for Voice of Connaught Radio FM 98.1 na Connaught districts. We dey na Kangama town, na the Kangama Grammar Connaught Chiefdom. We there for Kangi a coverage regarding the wind disaster we happened last night, yesterday, the 18th of May 2021. Of course, today na the 19th. We there today Wednesday for can see exactly what some of the disaster with the wind don't cause to the people in Kangama Grammar. Well, according to source, it's over 60-something houses we destroyed by the heavy windstorm yesterday. So therefore, can coverage and say exactly witness some of the disaster the way this particular blizzard don't cause to the people in this particular community. But we'll take you through some of the authorities and we'll go see some of the evidence of videos of destruction where they happen and the number of people and way homeless presently na this particular chiefdom. So we na Kangama Grammar Connaught Chiefdom.
Mina here Christopher Kanda, a catechist for St. Paul RC Church, Kangama. Over the night we see big breeze or wind that destroyed this church, and almost I don't communicate with the authorities in the community and also with the parish priest na Yengem. But they really try to cry to government and NGOs so that they go counter with it, because the kind of community where they live, a rural community, money business now at this part of the country where and they live on agricultural business and not easy for people. So they really make me appeal so that people go counter with it, so that the spiritual life of the people not go fall.
The house not up well now, they understand and they bother me. You sleep on the rain, no place, no destroy. I don't get no chance. The government help me, and they arrange for me. Yeah, at the day.
Mina Abdul Razak Subandi, head teacher of Islamic Primary School, Kangama Grammar Chiefdom, Connaught District. And this disaster we don't happen really, it don't damage the school. And for example, they see how the structure is conditioned today. Learning material as well as teaching material, but could not destroy. Never go snap on and don't see. Really, this it will really affect this free and quality education for we picking them. Now we not get a free space. We say where they picking them, where they go able, learning go take place when at the learning process. And look the structure. Look the other one way they under. We not get no other place back again. Pass we get for help, ask help through from the government. When at the humanitarian group, the NGO there for let the kind of we eat. For let get new construction. Mostly because you see here the place with free space not now. And I'm insisting this. Look the other UNICEF building and a death trap. The way where the breed are scattered and they know easy. Look this because this now government assistance and they do this. And what this on the become now we here for can rehabilitate this school. But now breed all destroy everything. All the learning material, the teaching material, all up well now we hand. All the records then. Yesterday, everything got destroyed now. We don't know really how they do. Pass, we they ask the government, we they ask the NGO then, we they ask the humanitarian organization, they let the kind of aid. Immediately, we need new construction. We need other learning and teaching materials then, let the government can help you. So this is my message to the government, to the NGO, the humanitarian organization, therefore let them help me. really.
My name Mariana Junisa.
Which form you there?
Form 1, Islamic Secondary School, Kangamata. This business started long can destroy school.
Okay. So we don't destroy school. How you feel?
We feel bad.
What make you say they feel bad?
Because we not get ourselves for study.
Okay. So what do they expect from the government?
For them help me.
How for help you?
For make the school.
Okay. So they are all them to be so now you come be school picking there?
Yes.
So now because of the breast milk, you not even take na school today?
Yes.
My name is back to my side. So now with this incident don't meet the end don't care go the panels, we think that everything don't destroy right now, not get side for sleep, we not get place to serve the day. So the big papa government do our make it help me right now. Me na kumra, which no more not get side for sleep. We think they all don't destroy, they end don't spoil the house. Not get side for the dear papa government, the big make my help.
Mina sa Joseph Yamba, na mi own compound this, na the 2 holes on this. This way will be taken, na the roof na the veranda so, na the half the layer. Na the bobo na mi pikin this way the get damage yesterday. The tick for don pana, the damage. So na the zinc na the veranda so the roof. Na this house na damage. So we ask government make it help we. The government and you let them help me certainly because right now me I not get place for you know. The 2 also don't damage. I not get no side for you know.
Philip Ansmana, where we settled in Connaught, Kangama town, and at about 8 o'clock in the evening yesterday, when we come for encounter this breeze with the rain, notwithstanding at about 5 minutes to 10 minutes during that time, the breeze just can't blow off the zinc pull on from the hose. Picking them in there, I've been get one guy picking way been popo one bobo. As then just left the hose for come out. Now the zinc if we don't be in there. But up to this time, we not get no drilling place. Except we've been going to neighbor them, we cacking at the veranda until they clean. Up to this time, we property them all is scattered about.
For this thing happy yesterday, today we suffer. We no get little place, no nothing. As soon as we suffer, I mean a belle woman. So we have forgotten Nabi. Sorry for we, Papa. We forgotten Nabi. Yeah. My name I'm Natafure from Kangamangulama.
This come yesterday can't take me house all, it damage me house all. So right now they suffer me picking them. Now we do other side and neighbor please them. They sleep there. That's starting I don't sleep. But right now they suffer. While let the government kayaku and the NGOs let them kayaku, let them pull on the rain.
So do the government help you immediately or NGO them? Let them help you immediately with the suffer and families.
Well, plenty people in this particular community, homeless presently as I talk. Among them people where we get belle woman them, we get skumbrade, we get small picking them, and plenty school picking them. Then property and school materials, them school learning materials, and everything don't destroyed by this heavy windstorm way up yesterday. People in this community don't cry out to surrogate organizations like the district council, come to the other humanitarian organizations like specifically to the district disaster management committee for them going to central government so that they're able to provide them an immediate help. Because people in this community now over 200 people are now not get home who sell them for sleep. Property don't destroy, food don't destroy, nothing not for eat, nothing not for wear, and no sign not for sleep. So with there, they don't pass their message and they to the surrogate organizations. Please, men go come to the aid as soon as possible so they go for address this kind of disaster where don't happen to them. So within a given period of time, we no go take. And the community people and the stakeholders themselves don't express and say, this kind of disaster will happen, not ever happen at this particular chiefdom, and this is not the worst way they ever happen. So they want to seek the immediate attention of stakeholders, them, surrogate organizations, the central government, so they will provide them help as soon as possible.
Hello, Fambulem. Ona, good afternoon, good evening, good morning, and good night, depending on whose parts na the world we find yourself. Welcome to Sierra Media. We choose the show, and today na another discussion. We need to bring on zooming in, but it will be another salon discussion. Welcome, and if you are joining us for the first time, we want to say welcome, and we're happy to have you. And we hope you're going to have a good time with us as we discuss. And feel free for contribute. Feel free for send me messages of issues that we want to follow discuss. We may not be able to discuss them right away, but we'll definitely take those issues into consideration. Me, Ona presenter Najuma Ba, and are they with the rest of the team here? And hope say we all go rub much pan today conversation because now a national issue we concern we all. So we regular viewers them, we say welcome again to Ona, and thank you so much for being our avid followers and promoters and the usual engagement. We hope today will be another enlightening program. We will all go learn from each other, the YouTubers as well as those on Facebook. Follow, we share with your friends and people that within your network. So then Sebin will benefit from the conversation that we already get now. I will welcome my co-host again, as usual, Mr. Sylvester Duba, for let us say hello to Fambulem. Tiboy, welcome to today's program.
Hi, Fambulem, and welcome, Kushe Kabo. Good evening, good afternoon, good morning, and good day. Hope you all get a nice bank holiday weekend. Is it bank holiday weekend or just holiday weekend?
Well, call it bank holiday weekend. Yeah.
Okay, yeah. Hope I enjoy on a bank holiday weekend, and I believe say the half term is over. Kids are back in school today, and definitely for us in the UK, the job just continues from now on to the rest of the week. But we'll not get long again for go because we can't get summer break soon. At the moment, we don't begin feel the summer. Imagine they feel the summer right now. Everywhere is hot. People are open. Their house doors are all open. Windows are widely open. Not like a couple of months ago where everything was frozen up. Well,
Wow.
It's just a sign to say, yes, you can go out and mingle and hang out, but be mindful because COVID not done it. So you don't get this different kind of what they call now. Femi, I know about COVID. You go for tell me the new viral with it now. Because I don't know. I don't know much about the new one. But I think Femi know about COVID past me because in one place they test them every 2 days. Me that one channel will now go back to uni where I test myself. That was my first ever COVID test. Why the test, man? I began when I said, damn, I can't test myself. Me, I don't get COVID, but I started. I don't ever test myself yet, but today I can't test. I take the call equipment, I hold on me, so I look at me. I put it on my nose. Me have the end where they put it inside the small cup for check whether they get positive or negative. I put it inside the cup, I wash the teeth, that's okay. Now I put it inside the tube, wait for actually telling me whether are all clear or are not all clear. I put it in the tube now, set me eye. Because if I get COVID, I don't get choice. So when the thing come, it should be all clear. So I don't get COVID. And the first day I never go back to uni after 8 months. And me don't make an as excuse now because I don't want to go again anyway. I enjoy forget studies online and then I was. And then I said, damn, forget me can go uni, man. It get for take me a minimum of 4 hours for go and come back.
Oh, well.
It's not for easy. But they balance the COVID test. And I they make excuse say, I like the home studies, it's fine.
But finally we get for do them.
Finally we get for do them because we get production week. And if another part of the production, I will not have any score. Except if I are out of the country or are physically sick. But no excuses. I have to go in and be part of the production. So I was forced to do that COVID test, and I eventually did it, and I get the all clear, and go back to uni and begin to.
Where you were talk about the summer, and obviously some of we know they enjoy summer much because we get bad allergies and hay fever. So the benefit more where I stay indoors. So I know.
Well, me, it makes no difference. Me, hay fever, they catch me outside, the indoors, or I'm gonna do. Well, it was the one inside because if I open the door, pollen they come in, I rather go face the pollen myself said than actually they come meet me.
Right.
I sneeze possibly 50 times minimum a day.
The reason I make a mention that, I just want to ask forgiveness in advance if, if you as them see we they make something like that, let them know say the irritation and stuff like that. So now that make a mention that. But welcome Sequence Dumbuya, Abibatu, Bangura, Abdullah, and all the other people that we join with today. We appreciate una say today we kind of like mellow, we know that excited. Not so because, the energy, but the kind of conversation we they get today, it dampen with spirit a little bit, but we hope, say, at the end of the day, we'll be able to push the conversation and learn some lessons then from them. Mr. Obafemi Amilcar Pama, welcome to today's program. All right, we go try for get Alliance say hello to Fambulem. We ready, Mr. Pama.
Hello, I want to say hello to my dear.
Yeah.
I don't deliberately. Because some man don't begin say as I cancel the first side they say hello Juma, can you hear me?
When another line there
so I don't deliberately so you no go hear me, you go tell me say I know the hear you.
You know say that line there somebody pulled me up for 2 days ago on the street. It's like they are on the left for the tell family they say Juma, can you hear me?
Hello, Juma.
So all of us are being for that line. Juma, can you hear me?
Yeah.
Juma, they say loud and clear.
Loud and clear. So welcome.
Well, I go patent the line.
Yeah, Juma, can you hear me? As long as me said they get royalty become a name today. So tell Fambule Madu Femi and how the week don't be so far for you and which you expect on for today's program.
Yes, so it's been an okay week so far. Last week I've been here for self-isolate. So I've been working from home as well. But it's all good. As T-Boys say, we will place them because we get a lot of people every day, with the in and outs. We're very busy, so we urge to test frequently. And obviously if you come across somebody who show positive, you get for quarantine for 10 days from the time we meet the person. So but it's all good. I think possibly out of una all, the person who don't get tested the most. Right. I think I've been tested about 12 times. Between all the skips that I do earlier in the end of last year, earlier in the year, and obviously work related. But I want to touch on something before we begin. T-Boy right. From where T-Boy the cake way as I be T-Boy where they go school. Say they did university, is still the cake. Me I get for call university important. Say this guy soon I try to do something more time. They give bad name.
Waiting for do feminine for make like tap na the university. So
I tell you, let's just go for one duvet for her with one batteries.
The lecturer they know me age, so they need to go far for ask me questions. They just say Sylvester, you okay? I say yes, I'm fine. Okay, no problem. They know me age, so they don't need to ask me why you're not coming in.
Right.
They just ask me, have you taken your vaccine? I said, not yet. Why not? I said, I'm not ready for it yet.
So you on 35, you then at the high risk band?
Yes. Me on 35, at the high risk band a day.
Okay.
By right now, they don't lower the vaccine age. From 35 now, it can take.
Mm-hmm.
Yes.
Well, where you mentioned that, T-Boy and Femuna, thank you so much. And I know say today not to COVID specifically talk about, but it's very important that we get for the highlighted issue because it's easy as human beings for them become complacent and be comfortable and go back to the routine. Like how T-Boy say, COVID is still around, and this is the time that we have to be much more cautious. And there is a concern from, the international agencies that this third wave or third strain where they come, it hits Africa badly. And the countries in the eastern part of Africa are, so then they suffer seriously, and there has been a concern about Sierra Leone as well. So if you days alone, you listen to we do not, be complacent. And if you get family, then they please make sure say you share with them. Over to you. I see Femi one for buttress on that point.
Yeah, I mean, just want answer Tibo in question. The new strain named Delta. It be named the Indian strain because now they see that India they first detect them, but it's now called Delta.
Right. Okay. So Delta strain, it's there, and it affects if you in the UK, possibly, and other parts, it will therefore affect you travel, because if they don't say, it hits Africa badly, the concern we then get, because obviously we know the infrastructure, so Africa, two concern then get. Firstly, the third strain, and then obviously the vaccine, because people are still afraid for take the vaccine. So imagine then kind two trouble, one God business then. So do whatever you can do for save yourself, save your family, save your community. Do that as much as possible. No let down. Let's go to today's program. We talk about health issues. We know say we health show on Thursdays, but this one is specific because we talk about not the clinical or medical part of it mostly, but the infrastructure and the system around healthcare. We get for do with Salon. Say obviously the national medical and healthcare conditions in Sierra Leone. Waiting prompts this conversation. Things that don't happen. People go ask, why not now? No, it's not just now we're talking about it. We just ramp up the conversation. We don't get a whole show now. So with medical doctors, talk about the conditions of service and everything we concern providing, quality healthcare service for all Sierra Leoneans. And we've done the talk on subsequent programs. They will get specific program where they talk about health issue. But today, the concern get for do with, we're waiting prompter, we see a junior doctor or medical doctor in Sierra Leone, we die, and the allegations we, come up, say, not allegation because I'm not there to confirm it, but then say that because it in the ICU, light no day, so now it make it die. And the reason, if that is true, then not die of complications of the condition we get, but because of infrastructure failures. And so we want to discuss them. But before that, we've been approached by other people. We show, not just in Freetown, but in the provinces, example, Port Loko, for example, a young man gets motorbike accident, they rush in a hospital, care and go there, he did it for hours and hours, doctor Noddy, then call and do all kinds of things. So at the end of the day, he get for die. And so many of these, they happen in seconds, in minutes, in hours, every day, in a different part of the country. We have to talk about these issues. We get for sure concern, because it could be you, it could be me, it could be anybody. Like how we've been talking now, so sick not a peak. It not a peak at all. It not a peak, who say you the sick. So now we could get for push for let we get better healthcare service. T-Boy, what do you want for say so far based on, the prompters for this conversation?
Like you clearly said, this is something we don't develop for the past couple of months, and I feel say we don't highlight so much of the concerns of the medical situation we get in Salon and the rate at which people are dying, not because of the medical reason, but based on the lack of medical infrastructure. Even though we both say the medical system is still stable, but people they still die. I'm not going to say now unjust death, but now death based on the fact that we medical facilities are not capable enough for adhere to some of the concerns then we the medical situation in the face. So for example, if you get any kind of medical concern, then rush you to any emergency hospital in Freetown or any part of Sierra Leone, your chances to survive is very low. Not because of the illness, but the fact is there is not enough structural mechanism we will make you able to survive that particular illness. Either be it medical facilities, not the medical personnel, not the medical basic, not the for me able to look after you. That immediate same day with the Connaught Hospital. Then can say the first 15 minutes of your stay in hospital will determine whether you're going to survive or not. Which means the first person will come in contact with you for know exactly what's wrong with you, whether you will be looked after, whether you will get the basic facility treatments where you need at that particular time they went in to see you. So that doctor will see you for the first 15 minutes when you take it to the hospital. They determine whether you will be able to make it or not. Not because in a God, but not because they reach out to you immediately when they see you and find out what's in your issue and how your issue can be dealt with at that point in time. So if you see he don't diagnose you just by looking at you within observation within 10-15 minutes, and he cannot do nothing for start treatment, or we will able to say, I will advise we start from A, B, C, D. Look, we start with A now before we go to B. They will be able to manage the situation when we get to E, F, G, H. Then your chances of survival is very, very slim. So that's not the thing where I feel to say we don't raise so much concerns about within the past couple of months. And like you say, there's been so many other concerns from different facets of the community all day, from the diaspora, from Sierra Leone, from Freetown specifically, from the provincial town, the way you mentioned Local, and the suburbs them, and even my own village, because some of the fatality that we get during the storm disaster we kind of village, we still don't know what's the nature of the people and we injured. Although some of them, they don't come out of the injury, they come on air and talk publicly on television, on interview, but we still don't know what's the internal impact of their injuries and death. We only know say no more, they were taken to the hospital and they are back home. But guess what? I didn't even know where my health center is in my village. That's how bad it is. Because normally they can be na the cut barrier, but I can't even find one. So imagine I go na my village now, touch you, something good to me. If we never forget bread for buying at the village, how can we get medicines? We are the most important thing we have to say for every community. Basic paracetamol, aspirin, Fensic, plaster, iodine, spirits for wash wound. You can't find those in my village specifically, if I'm going to be honest. Not because I don't go there regularly. Or yes, I have, but I haven't actually physically seen any of them in any way, shape, or form. So these are the serious issues that we talk about when we talk about medical infrastructure in Sierra Leone. Because if Freetown are one of the best places, we will feel to say the medical situation will be much better than anywhere else in Sierra Leone. And Freetown cannot even maintain some basic, then we are looking up to more than a disaster nation in terms of medical facility. So on a very short intro of what in me they look at right now a wider picture of lack of medical infrastructure. When I say medical infrastructure, it means everything from basic. We still just get the building standing, and those buildings are not really ready, fit for modern day. This is not the 20th, before 20th, or after 20th century now, because don't pass 20th century, we have to go down the road now. If we cannot really have anything to show for in terms of our medical capacity in Sierra Leone, then we are joking.
Well, again, what's an irony? We can't talk about possibly the specific case. I also will not get 100% details on it, but, just the issues around that and how, that case study there can able for, other people can able for relate to that one day, you want to say, oh, don't politicize it. But I like for make highlight because president states that other countries then they come to, we not envy when it come to managing COVID and all that. So if you can't have, the basic taken care of, so why should we be proud to say other countries then they come to we for medical? But we person sick, we they run for flight and come out of the country because on the oxygen machine or they say, or you get one hospital or the one green oxygen machine you share with different clinics or different hospitals depending on the doctor, because that I can tell you for free. That's still we don't witness. Wherein a certain hospital where I've been going to at one point I admit, and this hospital, the consultant or the doctor, they work in another hospital. So, and they work in the main hospital where na Connaught Hospital, but in gets, you get the oxygen machine. So it travel with us. Remember, like whether member of parliament me can say get generator where they go lunge. Yeah, it travel time. So if you get for go na this clinic, Connaught the go time. If you get for go na the other private clinic, the go time. If you get for go na the other one way na the luxury clinic. I refuse for mention name that I just mentioned Connaught and refuse for mention the other two them for let them not feel they try for pull down. What you call them, people and facilities them. But this same consultant, they work na them 3 side and they. So they get for pull oxygen one side, can go other side. And the people that when are medical people they know it in that one they mean. If you not get standby or you not get readily available oxygen for somebody that rush come, we really need them for survive. So it's sad. Let me come to I don't know if Femi get anything for contribute yet at this stage. Okay, I'll come to Femi later. T-Boy, I don't know how much you're familiar with this issue. Like I said, an allegation, we don't have the facts yet, but we still have to discuss the allegation because based on this, we'll be able to get the fact. Because Salone, for able to get official information, you get for go round and round, I get for pull on a teeth force, then fix denture for you all thing, the denture dry, everything you begin eat with time before you even get that information there. This young doctor, Dr. Wale, then say, you get some kind of issue, then at the ICU, lights not there, and as a result of that, he died. Not talk first, but the human aspect of it. You're a medical doctor. You friends, they own all the treat other people, them on the joke, on the laugh. And if it is true, lights not there, then can they admit you, your colleagues, they all come out all over, then drop waiting and they do, then can't treat you. But they're not able to save you, not because they're not try, but because light's not there. Imagine that kind of situation. What do you think? What do you think they go through? Then doctors, then their mind right now, and the nurses, the way these guys have been their colleague, they're not able for saving life. They're not even able to try because of this situation.
Well, to me, I feel saying two things. We all sitting on we all sit down on a time bomb in Sierra Leone. Medical, education, every aspect of life in Sierra Leone, we're all sitting on a time bomb. Just don't know when it is going to explode. The reason why I say that now because of one. As a medical doctor, you only practice because you feel say you want to serve you people. Okay? Not because you really feel say this job will make you become healthy, rich, or filthy rich, or this job will make you satisfy your conscience, say you're serving your people because you have all the facilities around you. So yes, you're willing to serve. Not to foresee you to serve because you feel to say, well, if I do this, I will feel satisfied. I think is none of the above. So they are just serving as medical practitioners, and then not say definitely they don't have the capacity in terms of their infrastructural capacity for made and deliver. So then just they go with the flow. Right. If I'm doing a job as a messenger and I feel say me level where I get no straight, all the houses they want to be in a salon not get for straight. Because my level is not even straight. I don't have my level to fix my corners. When one of the biggest problems I do get a salon. And look at the medical side now. If I am a doctor and I'm struggling to give my patient oxygen, how can I make them survive? If I'm a doctor and I'm struggling to get electricity, when one of the most paramount items in a hospital environment, how can I make my patient survive? So if I'm a doctor, I don't have my basic needle. I have to tell my patients to buy themselves needle and syringe for give them injection. How can I make my patients survive? So I don't know how they're doing it, but I think they are all sitting on a time bomb.
T-Boy.
And yes.
I just received a text message from one of the viewers there, able to come on the platform. And we want to apologize to them and everybody else we feel very sensitive about this topic, but he willing for we share in thoughts with other people. He say this one a topic too sensitive for me because na so me mama go hospital and die because oxygen not there. after you don't sit down at the hot car for how long? And in brother been get for go, even the bed sheets at the reticular and noddy, bed sheets in brother been get for go buy bed sheets, pillow, and everything else we in need for use at the hospital. The sad part, 2 weeks later, the brother will be the help for take care of the mama. The same situation happened to the same thing himself die. This happened within, a space of last year actually, and this happened to this person. And he said, countless stories of the same kind of situation. So I just wanted to share that. And
like you say, this is nothing about. This is not something really strange to many people. What make I say so? Now the fact say, if I can recall back about 30 years ago, 5 years we are born. Me brother me get same like an issue. He just walking no more down the road. He begin vomit blood. Nobody knows what's happening. The wash and go Connaught. It's a long time ago. You can't believe say we reach Connaught, then tell me say you better don't go hospital to Connaught. I go Connaught. I'm not able for Siam. The moment where I Siam, this na person we then say don't vomit blood. That's another. I just choke no more. That's it. They rush and go hospital. Then all of a sudden, I go and meet his on a bench. He just the vomit blood is on a bench. Go the doctor. They refused for Siam until he out money for me, then fill the form for me, they register and say don't come to hospital. This is like 30 years ago, not like last week.
So why those things should be happening today in the 21st century? Exactly.
Thank you. So again, like I say, I don't know how people practice in Sierra Leone, but even we were not so super professionals. When we say we want to do what we do so, we make sure say we get the right tools. We make sure say we practice and learn. We make sure say we find a way how we could deliver to the audience and make them understand we properly. If we cannot deliver to the audience 5 days a week, we don't tell them say some of we take our full-time job, some of we self-employed, some of we get plenty other things they would do. So we cannot satisfy una for good enough Friday, but we'll go try. So for the fact say we don't make commitments for say we will come and do this, we make sure say we do them. So if I am in Sierra Leone and I'm practicing, I don't go spend 10 years in a medical school. I don't study done. What really are they can do for make I actually practice physically, going to practice with what I don't go learn? If the basic thing the way I for practice with no day.
Wow.
So basically, when a doctor walks into a hospital where they are assigned to, they work out with all things. They work out with all in medical equipment and way in need for use personally. Like you clearly say that doctor or surgeon, consultant, they work out with in oxygen. Funny enough, when me sick na freedom, na Femi na me consultant. If Femi they
Femi na pepe doctor.
Not a pepe doctor, Femi is my consultant, and I'm very serious about it. The only reason why I'm saying this is because I will trust Femi and say to Femi, these are my symptoms. Check and let's cross-check and see exactly what has gone wrong. And let's cross-check exactly what medication I should be on. And let's cross-check exactly what is my dosage. And sometimes people think you're very stubborn, you're too extra, you this. Why are sick in Africa? When they drink paracetamol, I drink water. Even in London, because I never forget used to taking medication, tablets, because I've been very regular in Freetown. I cannot be the leave Freetown for like a longer period than I can London. So if I don't leave Freetown for 11 months, I can London for 1 month and go back. I was practically living in Sierra Leone. So, and I can say touch wood, all my 7 years or more when I was in Freetown, within that full-time platform that we have been in after alone, I've never been to the hospital.
Well, again, within Me not they blame the practitioners then because, like you say, they don't go study for camp practice. But if it's infrastructure, no, they not to their own faults that one day. They are doing what they're supposed to do to the best of their ability because they don't say, oh, it's in this I get for can do. But for let a hospital day,
I would throw a challenge to that.
Okay, we'll come to that just now. For let a hospital day, light no day, let a hospital day, the basic things they're not there. It's a problem. The reason they say you can't blame them. When the doctors then down tools, more people they die. And who that would they blame?
I would throw a challenge to that.
And I can always say we they blame the wrong people for the things that really happen. That's my take. Over to Eli, you challenge.
Okay, I totally understand the point where they make say you don't blame the doctors. Yes, I will not 100% put the blame on them, but I will give them some amount of ownership, responsibility ownership, professional ownership. Let me tell you why I say so. One, I don't practice. They're not assigning me to, for example, cottage. Yeah, I walked into cottage and I see say cottage not fit for makeup practice because they not get the basic infrastructural tools that we go make a practice. I can't practice. It's as simple as that. I turn around and tell my teacher or my headmaster, if you don't provide me the right blackboard, I won't be able to teach my students. If you don't provide me with the right syllabus, I won't be able to teach my students. If you don't provide me with the right teaching materials, I will not be able to teach my students. So I walked into the hospital. I expect to get the basic necessities the way I need for practice. One, I need my stethoscope, if not so then call them for sound patients, for check blood pressure, for check blood tests, for check whether your temperature high or low, for make sure I get oxygen just in case we get a patient who's walking and you're able to breathe because you not get oxygen. Those are the basic first. I need to get a proper first aid kit where I'm able to amend to any wound or any sore or any emergency accident we walk into my hospital whilst I am serving. I think I need those basic. If I can say to my employees, who employ me for work now, cottage, and tell them, say, I cannot be a midwife if I don't have certain tools to deliver my patients who walked in here when they are on labor.
T-boy, I understand what you say. That's what you need. But is that what's happening? No, because, look what, for example, we saw a medical doctor raising issues, They say cottage. Where you go there, you get for carry your own water and your own blood. It raised that issue there. The same doctor raised an issue at Connaught Hospital a few months back, say the place dirty, not fit for purpose, maggots there, that's tumbled and they everywhere and all that thing and they. What he end up getting? Now beat them. Where them beat them, what happen? Colleagues Sierra Leoneans, some of them turn pan and they justify why make them beat and say it try for give bad publicity to government. Few months later now, in colleague na in die so na intensive care unit because lights not the allegations say lights not the. Now hospital.
You just don't answer the question because I
what my point is. We easy for let we say, but you can't be apportioning blame to the wrong people because this now it make the people that way responsible, not they do what they're supposed for do. Infrastructure, not to the medical doctor, they put infrastructure together.
Yeah, but if you know that, how can you practice?
Well, but so then they make do with what available because they
no. Now they get it wrong. Because when you make do with what you see, it means you have accept what you have seen and you compromise your profession.
No. So my point is, this should not be an issue just for the doctors to deal with.
Definitely not.
This is an issue where we all suppose for talk about, we all supposed to join them and make sure, say, we push the conversation, let the people, not only crap conversation wherein you have a president will go and sit and say, give a rhetorical, comment, or we get the best facility, and I make them all, people they can learn to we. When for say, what they say so is untrue. You will not go to Connaught Hospital, you as a doctor, where you sick, as a president, where you sick, you're not go to Connaught Hospital, you go Lebanon for treatment. Because you know trust, say the facility not there. You have the T-boy, go ahead.
No, I need to stop you right there because I want to stop you right there.
Yeah, I understand.
Now because of, okay, I understand also you the commot, but my boss to them, if I can find you, for example, painting, me a painter, I am a decorator, interior decorator, and you've given me half a gallon for painting your living room. You expect me for use half a gallon for paint your living room? What shall I say to you? But this paint is not enough for paint your living room because you do now half a gallon. I need a minimum a gallon plus for paint your living room.
With all due respect, T-boy. With all due respect, I'll let you example. It's you know they compare we get for make a life and death situation. Except you are not human.
Now, okay, I totally understand the practice of
when you make life and death situation, somebody can you say, oh, because I don't get stethoscope, I don't get this, I know they look after him and this and that.
No, that's different. Not when you are there. Again, when you there in any position where accidents, fatal thing happen, the first thing they will ask for is there any doctor in the house?
Yeah, or medical person.
Or medical person. Yeah. That's the first thing they will ask. If there is any form of disaster or medical disaster where entails medical attention, they will ask, is there any medical professional in the house? Yes, no, okay, now let's do makeshift. Because we've agreed there is no professional here who can deal with this, then we have to deal with it. That's different. But if you are now walking into an environment to save lives, you don't have the tools to save lives, don't walk in there. Because you're the walker into a death trap. Because you know for sure that is likely 110% somebody is going to die because of lack of ABCD. And you're walking into that death trap. Even you might be that person that will die.
Right.
So that's literally what we are doing in Sierra Leone. We are walking into our own death traps. Because we the compromise with profession for satisfied people. I've been given an appointment. I know for me that person they feel bad because of they don't tell me say T-Boy, they can't give you a job for make you go be ward assistant na Connaught. I am qualified, but I know I don't have my uniform, I don't have my right shoes, I don't have my right tools. But I'm still taking the job. Because at the end of the month, then they pay me. I am only concerned about my pay. Not for the fact that I am going to be a ward assistant, making sure that I have people that I'm going to look after to save them. If I don't have the right tools to save them, I am fooling myself. I'm actually going into an environment that if anything goes wrong with me, nobody can even save me.
I agree with you what you say.
So if we put ourselves in such risk, I am not saying we should take total responsibility.
No, agree totally with what you say. Like
we should take some amount of responsibility. This is about ownership. You see,
yes.
If we not start for own some amount of responsibility of the fault there who would get in a salon, we can never solve those problems because every individual Sierra Leonean has some amount of responsibility on their hands to make sure that they do the right thing. But when we neglect the responsibility, that's when we start shifting the blame.
I agree with you, say situation like this.
And we can't do that.
You know, and the doctors are not supposed for, like what you say, just for Butker's point, doctors are not only supposed for raise an eyebrow when it happened to a colleague of theirs. Not only when they beat a doctor, on all this on they sit on strike. Not only when a colleague die, on go raise the issue. This is supposed to be something like what you say, your role, in as much as you provide service, but for advocates. You have an advocacy role for make sure say you get the right thing there because you're not doing justice to yourself, you're not doing justice to your patient, you're not doing justice to the nation. I agree with that point, say. But my point, you know, majority of the blame goes to the people that were responsible in our government, because our government had and they provide services, now them. And then they get all these big budgets, you understand? And for me, anyway, I'll call them the lie, where they then go lie, say, we don't do this, we don't put this in place. Which of course people did that, but you say not trust your own system. If they tell any of them and they say go Connaught Hospital, they're not they go there first. They're not even go near this. So they're not even who's call up painting at Connaught Hospital for where them give them office position. The last time, what you see here, the new minister sacked the one at mortuary, yeah, because they say the place they smelly, the this and that. That mortuary they don't outlive in usefulness. Almost even things they inside that mortuary they to start with. For start. Almost freeze are they. So if the main hospital not get electricity, how you expect the mortuary forget electricity for the cold room? The last time when we hear about then kind of really happened so was in the 80s. That I remember where you say Sierra Leone was the darkest city in the world. You understand? Mortuary, go pick them, they go thief the diamond them, then they go take the diamond them body, the aid or things, the parts them, yeah? That was in the 80s. But for like they happen today, somebody die now ICU. It not die because of complication. It not die because in colleagues and try, but it died because they allege say lights not there. So you want to tell me say Connaught Hospital not get 2 standby generator, not one or 2 standby plants where forget in your electricity where they operate on. So if person in a theater, you understand? Person there they do operation panel. Look, go back. Now so where video been come out where and says the theater dark. Wait till them be say they say that propaganda, not so. They said it here that that propaganda on the bad mouth people them on no one for appreciate what the government they do and things like that. But that's all bull crap because you get a hospital who don't see her now. And the reason make this the hot smithy boy. In as much as it happen everywhere. But you know this guy will die? Young guy, young family, 2 kids, again wife. This guy, I can attest that it pull money in pocket for take care of patients them. I personally can attest. Because I not be no saying that the person this why I see the thing they go around. Now just because before we go on air so when somebody see the flan and call me. He said, Juma, you don't remember this person? I say no. Go do that medical mission in 2017. This guy volunteered his time with us. We will be the fold up. We left about 3 patients there, which are one of the patients that need surgery. It was on a holiday. This guy left. He say in the volunteer in time for go make sure say he do the surgery for this guy, for this speaking. We not pay him nothing. And now he needed service. He get for die because lights not there. Now hospital will serve and possibly save a lot of lives where they not even pay them.
Yeah, Juma, I just want to make a quick mention on the UK NHS, specifically SODOC, specifically King's College. King's College Hospital 10, 15 years ago, we are struggling. You know what they were struggling about? They were struggling on the fact that there were many young girls going through cesarean at birth.
Mm-hmm.
And it was costing the NHS serious amount of money.
Mm-hmm.
What did they do? They realized the SODOC community is full of Africans. And they realized there are so many African midwives within SODOC community. And they were just like doing care home jobs. They were not really employed at the NHS as midwives.
Mm-hmm.
So they did a rapid survey within a couple of months, and they realized we can tap into these resources of the midwives that we have within these communities and find out what's the problem. It was first issue with the white community, and then it drags into the ethnic minority community, and everybody start doing cesarean. It becomes fashionable. And you sabi we are African midwife, they need to joke with you and say, Cambon, now for Cambon, not for play. Then they begin asking not to nobody to go pay food.
They're not supposed to say that in the first.
Thank you. But the reason why they use that strategy is to bring in the actual practice of women giving birth naturally than using cesarean, because cesarean wasn't safe. It wasn't 110% safe. So the fact of the matter is, people were taking too much risk in doing cesarean birth, and they were coming back and back and back. And it is costing them a lot of money and risk.
Right.
So they recruited a lot of Black or African midwives within 6 months. Drastic cuts.
Right.
So massive cuts. So these are some of the things I'm talking about. If people will get the money and the resources, they are finding ways to make sure that they get the practice right, not because of just fun, but there is risk involved in continuous cesarean birth. Many women will know that. They find a solution. Now we are in Sierra Leone. We have people who they send to medical school for 10 years, 10 good years. Then they train for become medical doctors. I remember 15 years ago, we have a brain drain. We lose 90% of our trained medical doctors to the UK and some in America. But majority of them came to London. And most of them right now are seasoned doctors in this country.
So, T-Boy,
what I want to highlight that the fact say, if we have these trained professionals and we're not giving them the right tools and they are accepting the wrong tools to go and practice, then for no say, then they work out inside that trap. Then say, is a bad comparison to make. It's a very bad comparison to make. But the reason why I am making it now, because now a comparison way go trigger a lot of controversy. When Malcolm X said the chicken have started to kill the young picking them, it means something very serious, right? Yesterday I was watching a movie and I came across a quotation. I recorded that quotation and I will say that quotation before the end of this program. It tells you exactly the mindset of the mindset of how we are right now in Sierra Leone. Now, an exact replication of Sierra Leoneans currently in Sierra Leone. But I will say that quotation before the program done.
I totally agree with you. And in the medical field, the one that we may not qualify for talk about that because I'm not a medical practitioner, but I worked in the medical field. I see around a lot of things then, I don't read a lot and possibly doing things, similar, that line there, okay? When issue then, every day, they sit, and assess what to make things then they happen. You get special people that when attended and they watch. Why make, a death they happen at this what you call it, waiting they cause the death and this is even if not infection, if not this, if not that. You get people them and then it's got different things them for change their protocols, guidelines, and what you call them for let them see waiting go work or bring up in new programs or new experts them for change that. That is normal. But what we're talking about here, for God's sake, T-Boy, it's not only medical practitioners. These are lights, I know they. Lights, where they switch on, off. The people where they make the decision cannot live without electricity for 1 minute. They will tell you, say the air condition. Oh, you need to go put the generator on, the AC don't go off. Put the generator on me Wi-Fi. I need for check me WhatsApp, me Facebook. But you can't do electricity 24 hours, 365 days a week for a hospital where you if you're not sick, because or possibly you sick, you're able to go overseas, but you get a family member we get for sick. We go yonder. Or somebody will be vote for you, we dance for you not treat. Simple electricity. We president. T-Boy, we president in May 18th was the day. He was in parliament. What did he tell me about electricity?
Do you want to go back to reference? Give me 1 second.
Yeah, what did he say? I want you to go back to reference about electricity. And that first paragraph, I want to let you read them back of his speech. That first paragraph, because we have to bring that into this conversation. We have a young guy, a promising guy, where for being decided after I don't study, don't if for being go to a country, then they pay him better money, but he decided to work in Sierra Leone. He served people, they left to picking them. He died because lights not there for let them administer treatment for her or stabilizer. If true, it will, and the reason make they say this, which make they emphasize on this allegation because we don't get official statement, but I don't see somebody in statement from the Ministry of Energy we actually come. That was the most embarrassing and shameful statement I don't ever hear. And I'm definitely sure the minister didn't know about that. He came out overzealously and can talk, say, oh, indeed, the hospital contact them, say, they're not going to provide for we light because we get these patients now. They said try for provide. How embarrassing for a hospital get for calling for beg for provide light. A hospital supposed to get 24 hours light, T-boy.
Are we doing a calling? Somebody's requesting to call.
Yeah, we'll open the phone line.
Okay.
You know?
I just defend your document.
Defend that document. We need to see that. And that first paragraph has to be read. Follow remind. This and that now they remind. For me, President Bio's speech, the way ever I don't make, importance to me than that first paragraph there. Because they don't show everything. If you come tell me, oh, but this not to today start, I don't care about what started 10, 15 years ago. People, do I die today, die under administration? It died under administration. We never hear any information or press release from Connaught Hospital or the Ministry of Health. Nothing. Nothing. I would have been a victim. It would have been you, T-Boy. It would have been Femi. It would have been anybody else. Just like how you say.
What's your make I read?
All right. Go first, the first paragraph of his speech in May 18th speech, I think.
You got problem with you.
Yeah.
Okay. Then the one that says citizens should understand their rights, rules, and responsibilities. Why it is important to abide by rules and laws. What equality and leadership mean. What public accountability entails. Why respect for diversity and national cohesion matters, and what it means to care for the environment. These are essential elements of a disciplined, inclusive, peaceful, progressive, and resilient society.
I rest my case. That is say everything, yeah, but go to electricity, energy, or whatever, the paragraph there. Where the president talk, say he don't provide abundance of electricity or whatever. I want for you to get the correct statement.
Okay.
It is important that we have to be reminding people about these things. So let us say not to rhetoric with the eat. When person sick go to hospital, not to rhetoric. If lights not there, it die. Alexa, if you get the best surgeon, the best practitioners, if there is no electricity, that patient will die. Or you go turn vegetable. You then a wheelchair, not die, you're not able to talk, you're not able to do nothing, you sit down there. It become a burden to himself, a burden to his family.
Okay, increasing energy access, right?
Go ahead, yes, sir.
You want...
Not to opting to read. I want to let you read that portion where say we have generated.
Okay. Then at 10.110.
Okay.
110 reads, we now generate sufficient electricity in Freetown, but we inherited a defective and decadent transmission and distribution system that is incapable of evacuating and transmitting the power that is generated.
Okay.
This is made worse by the deliberate vandalization by ill-motivated citizens of transformers, and installed equipment. Therefore, let me state that citizens who are engaged in such vandalization activities will face the full force of the law with support from the World Bank. My government is currently addressing the perennial problem of load shedding and massive inefficiencies in power evacuation and distribution in Freetown by expanding or upgrading the 33 kV, 11 kV grid in Freetown. Distribution transformers and lines are also being installed in 33 unserved communities. A vendor supply process for electricity meters means that meters are now easily available.
All right, so go back. Thank you very much. Go back just to that line there, no more. Sufficient.
We now generate. Okay, let's start again. Femi, just the feel hot. We now generate sufficient electricity in Freetown.
We now generate sufficient. So you generate sufficient, but Connaught Hospital they not get light. Connaught Hospital.
But Connaught Hospital to just Freetown.
And I make a specific to you now. They're not cut what you call a wire than a Connaught. They're not cut what you call a cable them. They're not get load shed. Now lights now not in a Connaught Hospital. Connaught Hospital not get light. So that should be an embarrassment to this government for Sidom say patients then they die because lights not there. The mortuary they smell because lights not there for able for operate the freezers them or whatever they call the things outside and they put the people in at the morgue. Lights now not there. You want tell me say they're not able for buy the money where they take for go build. What's in them build recently, Seth? All right, I'll find the thing where them build recently. You want to tell me say that money they're not enough for buy 2 generator where they on standby. If one day what you call them, they switch to the other one for Connaught Hospital. You want to tell me say that money almost it will cost for buy 2 big plants them. You want to tell me say by now Connaught not for able for don't get solar. Form of electricity for take away the others, the major one like during the day and other communal areas and for electrify day. Say patients they die. I see Femi want to say a couple of things. Then we will get for open the phone line, so stand by, but we'll get a video as well. We'll get for play for now. Over to you, Femi. Lawyer, which you get for say because it's getting a little bit hot here, man, T-boy.
It's getting hot in here.
T-boy, let us sing. Let us sing. Don't say T-boy won't be artist, both sides. No,
I'll be artist, but come on, we'll sing it.
Guys, thank you for this. Really and truly, who say for begin? The salon problem, they done. Every week gets in. It's like in a Hollywood film we can watch. You remember season say una don't begin.
Every day they kill some. We will left the anger.
You don't patch one area today. Tomorrow all boss other side.
Femi, what I can tell now say salon problem are like a rotting clothes where you try for so one side other side chair and I can feel saying a joke. Now you don't like to continue.
Yeah, I mean, I'm not sure if rotting clothes on the right word.
Right.
But really and truly, I want to take on back a few steps when I've been discussed earlier on, and T-boy been make some points them we agree with in many ways, and I disapprove with some of his statements that we make as well. But a few years ago, I got offered a job now a prominent hospital. They may look for technical staff because them in the put some technology together with for app for operations then for apping inside the person in body without cutting the person open. So then you pass cameras them into into their, different holes and embody them and able to operate on them with technology, basically. And they wanted to hire me for, somebody recommended me, and I got an interview. But honestly, the work what they do, if I get a very, very, very bad day with my team, maybe a few £1 million event not going to take place. But it's not the end of the world. A few people are not going to make certain money, certain deal not going to cost, but it's not the end of the world. If I've been taking that work day, I get a bad day at work, somebody they die. So I understand the side where they come from, where they say sometimes some of the doctors them get for be a little bit more responsible. I think that a lot of people in salon know the talk, and that's half the problem. Waiting we people in military we say where you backyard dirty now for sweep them, because if you not take them, the breeze go blow the dirty inside your house. I'm not saying that it's a good thing say one of them perish at the moment. It's sad, but this is the reality in Sierra Leone. It happens every day. Every day families are going, they're crying for untimely deaths. They see from old people them, we until we will understand slightly. We go hospital for one reason or another, no make them out. We see middle-aged people them go with broke and no make her out. We see youthful man them and woman them we full of energy. They go hospital for belly arts or whatever, they don't come out. We see picking them, they go hospital, they know they cannot do. We see expecting mothers, then they go for go born. They or the picking them, sometimes one no go come out, or sometimes both no go come out. It's we live in the information age. I keep saying, statistic wise, Sierra Leone health system is poor. So even if we papa them, we mama them, the big one in the country, even if they know people that they go through the entire so, then for know the statistics them. And for make people and they say Sierra Leone is all well and good, I'm sorry, I still boys say we're a time bomb. If any of we go holiday, we get any kind of emergency, now the hospital and they will get for go. And that's the sad thing. Sometimes we'll get the opportunity if it's not too much of an emergency, so we're able to take return tickets and fly back, go so we come out. But certain people will not get that opportunity there. You understand? The same Connaught with some man and they look down on, that Connaught Hospital is the life savior for certain people. But if you imagine, say, where you go there, there's a chance, they come out there. For many, many reasons, it's sad. I don't know some people talk about air conditioner. But London right now hot like crazy. I can imagine how salon Kintalek. Then you do work under pressure for save somebody in life, then light go. It's really and truly, it is incredible. As I say, I'll get a few more things then for say. I think say today or yesterday something happened in America. We something for do with Obamacare. I don't know if Juba, if you are aware of that day, we could touch on that day. I think say the President Biden don't pass the goal back. So it's in President Obama been work on when President Trump can they revoke him. Joe Biden don't come, and the thing is all good. So today they were congratulating themselves. I don't follow the story much, but it will be good if our leaders can actually fight the case for the average man. We can't afford for jump on a plane and go Nigeria, go Ghana, go South Africa, go Lebanon, go England, go America for treatment, or go India. We need to look after the general public in interest. Healthcare is the government's responsibility. So that should stop with them. But as T-Boy say, some of the practitioners already work, supposed for the advocates, but they already complain them. Not to one, not to two. We know people them. The doctors don't say anything. There's no inquiries. There's no autopsy. There's nothing. People just die in both cases. So I go left on Nayasu for now. I've got a few more things to say, but I go left on for Nayasu for now. We were supposed to have somebody who can join me today, but instead get another emergency we enable come and a medical emergency. So our thoughts are with her, and we will call after the show and see. It is alone. It gets a healthcare emergency, so you can imagine.
So imagine the kind of stress. Yeah. So thank you so much, Femi. You don't highlight some of the things Sam and Rieko and paint and fine as well. It's sad, and you talk about healthcare and government business. You know, now two UNT boy don't make reference to the NHS, and with presidents recently during in town hall meeting stated that he want the healthcare and a salon for be like the NHS. How can you mirror your healthcare and want it to be the NHS, but under your government, lights not there for the main referral hospital in the country? Connaught is the main referral hospital. You don't have electricity. Then no one not tell me so don't blame the president. Now the president are the blame. Because by then tell me also, you know, the people are very responsible. You don't sack them, you don't kick them, come out there and make sure say 2 brand new generators then don't do. If una can buy motor car, SUV, una waive procurement rules for buy motor car for say una they put three Prado Jeep them for how you call it in for innovation and technology. Then una buy boku Prado them for COVID. We take the COVID and they argue whether a new one, so one part the minister can say a new one, the other one say an old one, the other one say a brand new one, the other one say a half and half. And the first government, this one see they buy jelly motor car, half and half new, you know, brand new. You don't even know how to call it. But you can't afford to buy 2 generators for a hospital where person they pray for sick. You spend money on the things that when a luxury and forget for spend money on the things that we supposed for be what you call a priority, when a basic needs. We know every place where they deal with emergency gets standby power supply. If the standby power supply been there, then, you know, electricity go for, let's say rain, they can big rain can power, you know, what you call up or cable cut or this. That happens. Let it be say this person will die. It die because they try. Let it not die because of negligence from government. And like when Tibo say by extension, the medical practitioners, but then first role now for try for see how best they manage that person who is sick before they begin complain. Not to for say when they treat this person, what you call up. What you call the phone number Sulaiman Tibo don't post them, and the number for call on WhatsApp now +1 614 551 8694. Call and make a contribution to the program, and low you're waiting people they get for still on this issue, because I think the way they affect everybody. I know how traumatic it can be where you go on site. I don't meet up Comra middle net. Come on, it's 12 o'clock na net boy. I break. I see another family member then told this speaking. Then they cry, then see, then they wait for Okada. Like, who's having they go, say the Peking sick. All right, I say, let go, go. I can't go cottage. Imagine midnight. The first problem I get first now with the gates man. The gates man say me not for going inside, me for left the motor Canada. Finally, we go inside the Kumra. We go out, the way I see the place, that place where they put Peking, okay, we don't get a first call, no answer this call, no, we'll continue the story. Let me see here. Okay. Sorry, but I think the caller called, but he turned off his phone again. He will call back. We go wait for him call. Call +1 614 551 8694. Yeah, so we go see, but waiting me go see with me eye. It not sound like I say that same cottage they have been born. Okay. Then where they go they watch the pikin and they say they need blood.
How is it delay for talking to so?
And it's time for imagine if I was not there that night to start with. Where the blood, another blood bank, when I go for go find one family member for can donate blood. The mama, 12 midnight. Yeah, midnight. The mama, where you looking for, she is sick, she's malnourished, waiting, call her, watch her. Enforce need treatment. Enforce need treatment. So I'll go for the blood. It was no blood bank. Where you go say, okay, let them can't give blood, then you go get family member who can donate later. So imagine an emergency situation. You don't see this picking who can die. They breathe one. So what you will get for end up do? There was somebody waiting at the place enough for donate blood now day for. They say, well, one person there also we can donate this, that. Then take me middle night. Do say they work out me for go find that thing. I had to pay that person there for donate that blood day. But I'm like, how can I pay this person for donate? So you there in a situation between ethical issue and saving life. Now I make I tell you, say when you are faced with that situation, what do you do? Let's answer this call and see what the caller wants. Hello, caller.
Hello. The call from Philadelphia.
Okay, tell me your name, please.
This is Ahmed. I call from Philadelphia.
Ahmed, go ahead. Make your contribution.
Well, my brother, may God bless you all for this program they bring up every day.
Thank you.
You see, the problem that we country is very deep. And we politicians, they are not in the interest of people of that country. Some of us are even the advocate about the health sector and the health condition in that country for quite a long time.
Mm-hmm.
And it seems like the politicians don't even care. When I watched the last few weeks ago when I saw the president, they launched their SLPP office now, at the eastern part and the southern part of Sierra Leone.
Mm-hmm.
It brag about how many, SLPP office they build, how much they finish, how many percentage they don't finish. I have never heard this president say, oh, you know what? We already get how many hospitals here or health centers. I get friends that would come away some even though lost their family from true kidney disease in that country because can you imagine they cannot even afford to buy one dialysis machine when it costs $10,000, or they can buy a product that costs $100,000. Can you imagine? I mean, these people where they die in our country, they not to foreigner, now we brothers and sisters and like a citizen of that country.
Right.
It's very painful when we just sit down at the diaspora here, they watch, especially some of us will have love, not for any political party, but for the people in our country. We see things like this that happen.
Right.
It's very heart-rending.
Right.
And here we have a government where every day they lie to the people because being the fact that I believe, we have 70% of illiterate people who are not educated or know nothing. So we can lie to them and we can say whatever we want to say, they will believe in us. But this is getting out of hands.
Right.
It is really getting out of hands because with brothers and sisters, with mama, with papa, with uncle, with auntie, that they lost their life. It doesn't matter if we're not related, but any Sierra Leonean will die, a blood to all of us. So the government of the day is not doing the right thing to help.
Okay,
we need to call on them. They need to do better.
Thank you so much, Matt. Thank you. Let's answer this other call. Thank you. I appreciate your contribution. Hello, caller.
Good evening, gentlemen.
Good evening.
So relief we are getting today. I did care for calling all ladies there.
Okay.
But believe I don't relief. My name is Sulaiman Musa.
Sulaiman. Thank you for calling, and we appreciate you as well.
I appreciate you as well. I call from Hill Station.
Okay, Freetown. Okay.
Yeah, I'm in Freetown.
Okay.
I appreciate you now well because now the risk so now they take, now the risk in a life, now the risk in a family for come out and see the truth. you know, the issue of this person will die when I a doctor, you know, it pain me well, but it gets solution where we can see the problem, but pass if for we do not before we take action. You see, if we able for stop all politicians them from traveling out of the country, because 5 minutes what something happened to them, they're able to fly out and go, you know, cure themselves, while poor people in there, you know, they suffer themselves. If we able to stop these things by doing that, the government now the one thing what they blame, and I blame the you know, the parliamentarians them, because if we able to stand on those constitution for change those things, that anything will happen to any ministers or anybody, they not fly out. Believe me, the money they want the thief, then go put at the hospital there, then go buy generators and then place there. That boy go die today. You know, I first of all, I want to sympathize with the family. It's really painful for short things like this for happen. A doctor, when they try for save life, we don't save many people alive, they're able to save a life just because of electricity. You know?
Thank you.
There are issues them where we the see in this country, we know they talk them, we the search remote. But when you follow now with the remote, that's the time we they try for talk them. There are many videos then they will get what would they send to now. Believe me, I have to send many things to you guys. So that if you know, and they feel and where they see the forum, now 40, so I think 43% they watch you now, the viewers. You know, things and they will forget the best for the watch. We know they do them. We don't forget about that, we go on different things. But when it happen, I don't want to tell we go be issues, they talk.
Sulaiman,
you know,
you get people and they watch, but they're afraid for show their face, then they watch. Boku.
I'm not afraid. I'm not afraid because I know the pain where they go through and what you see today, what you hear today, it's really painful. My name is Sulaiman. I did hill station. I don't afraid anybody. I don't see I get on me right. You understand? I know me constitutional right. You understand? And I need afraid. But I get video they send to now. I'm not afraid.
All right.
I don't say me audio they go because I they make audios them, I they make many things them. But believe me, as long as I don't get to the number, I go to make contact with you now. I will give now every opportunities them where I get. I go to make videos them and send them for now. Please.
All right.
I want to tell you thank you for take that risk. You know, I risk on the risk on myself. When I get family in a free town, for me, I have base. I don't care.
Right.
You understand? I have base because I left overseas for Kaya because I know what I mean. I know go come out overseas. I can see people in the sofa. You know, it's not done.
Right. Thank you.
It's not done.
Thank you, Sulaiman. We appreciate you as well, and definitely keep in touch. Okay.
Thank you very much, guys. Thank you. God bless you.
All right. Thank you. Well, family, when I continue for call, we know see the call and the jam, so call will answer your call and give you an opportunity for share your views them on what's they happen with the healthcare medical condition at the country. And T-Boy, again, you know, people end up highlight or rub more on the same issues that Leon say not so we want grain they talk about. This is nothing personal, but it's the reality. You know, people have to act and people get for do it what is right for make sure say you know, we push your country go before. You can't just always say you want your healthcare to be like the NHS, then you come up and be like the NHS. No, if you're not care. You say they go build new diagnostic hospital, state of the art, the way you get not get generator force. So people get for die for stay build the state of the art. I sometimes don't understand really. All right, let's answer this one. Hello, caller. Okay, let's see. This call look the jam. All right, hold on, caller. Hold on. Hold it. Don't go. Stay there. Hold on. Hello, caller. Can you hear us?
Yes. Hello.
Yes. Tell me your name. Who say the call from?
Hello.
The contribution.
Yes, Juma. This is Adama. The call from Sierra Leone, Freetown.
Okay, Adama Mambo from Freetown. Now for talk loud a little bit so everybody go hear you. Yeah.
Okay, all right. Yeah, I call from Freetown, exactly for McKinney.
Okay.
I just listen to on a topic of the day. It's really pathetic. It's sorry. But as we discuss this doctor in there, we even don't get another CHO, one they work in call community health officer. We go do field work on the way back involved in an accident. HSF na similar situation they into right now. But then can go na both hospitals in there. Manitol, ordinary manitol, no day for make them able for at least they give us that kind of for steady and see what for do for them. Then they try for move and out to emergency hospital. So you can just see how serious this situation they become. That's Sierra Leone. But one thing we I want for know, this government don't get any respect for even the health of the citizens in this country. And what make us say so? We all remember say few months ago we get Captain Cole. We raised this concern, for help, for first, for make that hospital day clean. Then turn around against them. And right now, as they talk to you, so Juma, we get about 86 or more doctors the way they not pay this end of May because of that particular sit-down protest day where then they do with regards to the condition where then they walk in. Not of condition of service owner, just condition where then they walk in and then they decide say, well, they're not going to be at this anymore and they don't go molest one of them time.
Right.
So because of that one day, now 86 doctors then, 86 junior doctors and some senior doctors then they back where they not pay.
So then so the government they retaliate.
Yes, right. Yes. 86 they not pay them. As we then so now nobody no one talk. They don't finally succeed for just keep every area, every aspect of this country quiet. For talk. So right now, even the doctors then, they remember how for protest, but then some man they look and say back no, I'm not for do them. And the funniest thing now, among them one and they will be protest, so you get few of them will get a salary. Right? So you go really see who side the world is. Either they look for the name, or if they see that the first ones that the social media, if they post or whatever, then just decide for put you. They not pay them salary. Without any notice, you can imagine and get a family for take care of. Yeah? And this guy will die so. Very hard working guy. He just don't sit in primaries and pass them. He get up and down, go work like this clinic, just for make less ends than meet.
Right.
He go involved in this kind of accident. And then we involve the people where they all get the accident are in at first, we therefore even assist them. Or put them inside vehicle and make sure they transport them to the hospital. Now when it gets out to the hospital, now it get for drop and collapse. When they get for nothing at. So even the CT scan for scan that body twice and get for move them from the hospital for go send inside for do CT scan. If you imagine somebody already don't get head injury, then you move them all over the place.
Wow.
If you imagine, you can see how serious this situation they become. They don't get no regard, no respect for the health of the people in this country. I don't tell now say the last term, nothing absolutely they go on with regards health system na Sierra Leone. All what they do now just camouflage. This man where they not can put as minister, now the worst. So if Alpha movie, they were already did not begin to understand because in the read they ask, they want know, they eager for no, and you don't know the system. Sometimes before better, but now the same people and back when the SL people where they pull up inside the ministry, that then set because they want their young person before be the minister.
But Adama,
unfortunately for them, yes sir.
My point is this.
Unfortunately for them, the one with them the ones when in now just deputy minister, they're not candy and disappointed. They can't take this person with the work CDC or whatever. We don't even know what they get back.
One document for another man sign up. Minister.
Then them the one so they call one Dr. Jamba, and then the one. Then them the one. And that man there is just full of revenge. That Jamba is full of revenge. It's full of all kinds of because they work with the previous government as same deputy chief medical officer. But according to I say they ostracize them, they marginalize them, and all of that they say. So it's so bent on destroying the whole health system. I tell you. So they're not be able to make the minister. They'll not be all kinds of things and go talk about Alpha who we here and there, but the manifest stronger than party. Anytime they go talk, then they tell the man. So finally, they succeed for me, them pull and can't education. Then bring this man, I'm telling you, there's nothing going on with regard our health system in Sierra Leone. And I tell you, don't know, they're even tired. They're tired. Something like they just they do it because of bilateral using them. But honestly, they're not even want to put them money into certain systems. So we are in a very critical situation.
Adama, you know,
Juma, if you listen to me, please not just give you the thing no more. Go to TCM Hospital. When you go there, even the future for close up after cesarean section, you know they. What time are they want inside the
mention so we will not sabi better, we will not sabi the medical term.
In future, that the thread like that thread where they go use because you get different kind of. You know, say the abdomen where you open up, you get layers. So now different kind of thread like you they use, you know, for say you can mix the top skin, right? Say mix the top skin. So now different features then they where you go use each another day. Each another day, you know, it just pathetic. That's you know, they were no day. You know, I don't understand. All things just don't go worse. I'm telling you, all things just, if we are not careful, this 9 months we die in a Connaught is small. More therefore they die because Connaught gloves, near gloves, not they do. Gloves for the doctor for doing examination, you know they do.
Okay, so Adam, tell me something. You say that 9 people die?
9 people died last week, just inside one drain week after they tell you 9 good people died last week, including this doctor. Wow. Boy, what did they say? With other ordinary people there. Yeah? 9 good people inside one day inside Connaught died for condition they were preventable. We will prevent death. If they get treated for work with. But they're very good doctors then. And I tell you, with the doctors, the way they go to Cuba, from the way when they train them, they want to work that same way. But if they don't get the wherewithal, how they go able for do them? You don't get the instruments. Even the drug, I'm telling you, they say, hey, not for sell drug now, people visa, so. We go blame nurses and say then they sell drug. But sometimes then they be of help. Because imagine 2 a.m. in the morning, you see a patient, they in a kind condition where you able to get that drug to keep them alive. You know, they are so long the pharmacy, they all don't lock. You know, if you don't get that one day, you know.
Adam, are you there?
For sustain the person in life.
Yeah.
So, you know, there's a lot. But they're able to go build party office. They're able to buy a SUV. They're able for now that they blasted and don't build the tree for cabbage blade. They're able for take money they go shade the stadium. So people and just for make them gain, you know, that make they say they will people and vote with that one day. Right now as I tell you so we don't see say they even go thief money from the first lady, $500,000. When the security thief, they say they're under investigation right now. Then they're able to buy generator. But then people are day, now lunge, they meet like they then come. For me.
All right. Well, we call her in line court. Unfortunately, when I say in some partner salon, it don't highlight the issues there, man. Femi, want to say something whilst we get other call, then I'll bring T-Boy come in because again the issue then Bokuleka you say. All right, hold on, Femi, not go to please. No answer this one. Hello, caller.
Yeah. Huh?
Yes, please. Tell me your name, where you call from, any contribution, sir.
Yeah, this is Mustafa. They call from France. So now, thank you for this good work. They do. God bless you now for our precious time. The owner they give to we
thank you, Mustafa.
Country.
Thank you.
You know, it's what trending. Some of we at least we don't come on at them country and we've been blind at least we've been there in a saloon because some things and they will they see at them part of the world we don't expect saloon for ritual inside short time, but at least we'll be able to work towards that. Mm-hmm. But the only things where they baffle me is the government, the whole again at the country, they're not honest. They're so hypocrite, and then they fool the people, and then they can say maybe when they talk about education, so a lot of people know get that common sense. But if you can imagine how many party office would they had it and build within 3 years old, but states they look Connaught, look cottage, they're not fit for improve any system there. They make we own doctors themselves, they look them like say they're not sabi the work. But when they sabi the work well, and the material and they not get. Because everything, good mechanics, if you not get the material, you go do bad work. True. Then they happen now we country, and we country really, some of we they feel the pain. The government of the day, they not say the government do all things, but the basic necessity they work towards that day. But then just they work no more for waiting people and go say, this government don't do this government don't do this. At least focus on one thing or two things. When you know say a basic necessity, where we able to push the country go before. The medical thing, then they look them, then they ignore them. We don't get pass government, then pass government, then but we'll begin watch. From NPR system where the late cash will begin improve cottage. Mm-hmm. If we be there and go in that trend day, who shall forbid on the there wire? Right. If we don't go far, but when they come, then just they come and make that puppy show. Then get at themselves, they enjoy, go buy expensive motor car them, go buy speedboats where no get use, then park in a corner for because of the basic necessity and then they walk towards that day. Mm. Things that we no get use self, then they go and spend with money pan them. Right. Just imagine this Answer of Our Girl program, a very good project. But if you really focus na the medical force, go na the cottage hospital because na they some of we where they talk to na they want. Na they force you they begin. When woman go at labor, let feel that comfort for born picking. Mm-hmm. Let not enter for go born if you say like we enter them firing squad place. Right, we know say the ground up, let them go execute you. Yeah. You know? All right. Thank you so much. I mean, let's continue for yeah. Thank you so much for your caller. Hello, caller.
Yes, Jumana. Adam again.
Yes, Adama. Continue. So
yes, sir. So as I mean, they say, they're not able to forget common emergency drugs there. We for be like mannitol. They're not able to forget CT scan. They're not able for get simple gloves.
But Adam, if they get CT scan and lights not there, how the CT scan they operate?
Well, now this kind of the thing. So like when you don't bring this stuff to me, so tell me what are the essence, where then the bluff say then the bill bakery, where lights not in at this country, because they say then that first class bakery then the bill. And first class bakery, not a wood or coal they go use the. Now light. So why you not use? If you get that done or the other person, they support you for Bill Bakery, why not tell enforcement you get 2 giant generators there for putting at the hospital there? Right. Imagine the free tongue and the all thing they be so when you feel say the health system is easily accessible as you go on for stay. But what about the provinces? What about inside the districts and peripheral hospital them? Right. If you go to some them, you know, whoever wants to for making person go there. Because, you know, even FIBA hospital, you know, even, you go see one clinic there, now inside people compound, community compound, are they there? You enter inside there, until just the dirty, dust they are covered. You know, we will imagine. So Sierra Leone right now, which I don't know what they do. They don't succeed for keep everybody quiet. So by now, if not been that last government day, you see all the civil society there and Ulavali, Edwin, Edwin, and something, Edwin, waiting, my name, I don't understand. You will see the whole don't come more, then they can't talk, then will get subject for discourse. After they talk to you, so we local radio them, then they pick waiting, then they talk more. They're not going to even program there again because every day they're just the negative things they happen. So they're not even get programs. So they can just set for go see if one Chinese man don't count $65 million, I don't buy Black Johnson, then they can begin explaining waiting the Minister of Fisheries. Say nothing in there. But none of them talk or say they know they discuss on radio. Open phone line for let people and discuss their issues in there. Now we are able to. At least we listen to now, we know say people and they will keep for people in Sierra Leone, we concern for people in. But none of the radio that I'm telling 98.1, the AYB, they will never say anything about this way they go on so. And they're not going to ever allow now for open phone line. If they even manage hypocritically for open phone line, then go begin for tell you what you for talk and waiting for no, you know, for talk that they not talk so that then go tell you what you when they see the reality that they gone, they will never say anything. So the country, I just don't know. It just don't they dormant, it's so quiet, everybody is just scared, fear all over the country by people.
Right. Thank you, Adama. We appreciate at least we able to give people the opportunity for share their own thoughts and opinion. Issues. This platform is for we all, as long as we stay.
We appreciate you so much.
Thank
you. Appreciate all the program there so much. We keep abreast with waiting that they discuss. And the fact now that they say, and we just hope so that we'll continue for do this for we. Thank God and bring change for we. Although the change that we are needing. Thank you very much.
I appreciate you. Thank you. Stay blessed. All right, well, that's our caller from Sierra Leone. Let me take this one from, I think, the United States. Hello, caller.
Yes, hello.
Yes, tell me your name.
Yeah, Lamin.
Lamin, whose partner the state you call from?
Maryland.
All right, go ahead with your contribution, Lamin.
Yeah, I just want to tell Una thank you, at least for this wonderful issue we Una always come up, at least for give we Sierra Leoneans them the space. Please hold on.
All right, so you see this dynamic we platform unique. We work with people like own kind way them as much as possible. We're very accommodative here.
Hello?
Yes, Lamin, can you hear us?
Yeah, I'm getting you now.
Go ahead, make them brief. And,
okay, yeah, but at least I think really they are sad, follow the see some of the issues they are with brothers and sisters and they lost in life for something we not forbidden be. Some of we are Muslims, Christian, we know say we all get time. You understand? We they go. But at least some certain thing maybe if then systems and they in place, maybe something the life can still extend.
Right.
We're really unfortunate. For let somebody who be inside theater room because of light, that person they lost in life. I remember back days before maybe they travel. Me mama. One time in be even undergo an operation. But I need to go find generator for a cottage. I need to find generator, they buy fuel, before ever then they do operation.
Right.
That never happens self with other patients, we then become with the generator, while soon not become with will be the pandato sule na the doctor. Na MBA get for come out can advice for say well. Me or mama a situation is so critical. You understand? I think I be this Dr. Tolly be there na cottage by then. I don't know if that party is still there alive. So now you get for Canada and talk to them people and they before the people and they get for accept. They use their generator with the fuel. So later we reimburse. Then they pass. It be so sad. Can you imagine? Long time ago. Yeah, recently back from me, brother. A situation will happen. I feel say that situation they be happen. With that, me body back say be did song. I believe say it will be well only because I got na get that na get it die. But thank God at least and be fortunate for deal with Twina. So at least with that problem they come up, they do everything. You understand? We will not be ever be the expected. Do all, you know now. At least when they see someone and they do a lot of procedure, at least then be able to get for find out what the mommy issue. You know, at least now the mommy they recover. You know. Yeah, so at least they don't find. So they just imagine if that mommy they did something,
right.
At least we will be lost some, or will be really lost that mommy. Look at the talk of blood, like blood bank. You understand? We're all emptying and they do anything and they by tell them we're all emptying and they don't pass anything and they. You see? Yeah, because the how the mommy they feel that on it, then can't stop the knee, because it can be really too much better. But tell God thank you, at least and still they do well now.
Well,
you see, so just sometimes imagine I don't get that opportunity there.
Right.
Like one caller they talk say sometimes then I think say like how Nigerians or other nationals and they do. You understand? Whereby at least then they monitor. If say somebody left when a government official can America, you understand, for medical, then we lead, a group. Oh, they go protest against that person. They say let that person return. You understand? And for take any treatments now, we don't they see them videos and they happen Nigerians and other nationals and they do that. You see, so that them people like them will take the health system serious.
Right.
You see, really unfortunate at least I see that young man, the 39 years of age, can you imagine, for who lost that just because of them as well. Can you imagine?
Yeah. All right. Well, thank you so much, Lamin. We appreciate you for that contribution. Yeah.
Sorry, Juma. One thing again, imagine they do somebody operation. That same day they say the person for go now us. Now this Rokupa Hospital. One of me father-in-law. Yeah, my mother-in-law in Big Brother. Trust me. Just about 2 weeks ago, we do the operation. They do the operation like today. You understand? The next day they say the power for discharge. Wow. At least they go they come. Can you imagine? To God, I swear to God, my brother, then they happen.
Why they
don't fight the Lord? And now for the bed. The bed they're not there. It's sufficient bed they're not there, my brother. Can you imagine? The one that we party with now, what did they know? They don't know nothing. Now only God no more will help that party. Then I was up to this time about 2 weeks to 3 weeks. You see?
Wow. So
it's really crazy.
All right, thank you.
I tell you. Okay.
All right.
Thank you, Juma.
Wow. Okay, Femi, over to you. I apologize, Abigail, for take that calls then day and one for you we viewers then they say. But this burning issue we get for do with healthcare and the medical and healthcare in the country. Like contribution, we'll get a call. You allow to take this call or you allow you for okay, let us answer this call, yes. Hello, caller.
Hello, good evening.
Hello, good evening. We know they hear you better. Now for speak up a little bit, tell me your name and who side you call from.
Hello, this is Nakumba. They call from Australia. Do you hear me now?
Yes, Kumba, we hear you loud and clear.
Yeah, good evening to my own end.
Good evening and good morning to you.
Thank you.
Right.
But before I say what I get for say, I want to know if on a program there on WhatsApp, we're gonna make the message go to circulate to the salon. Most of the people in a salon, they don't get access to this program live like how we get on now. And I feel say this talk all we wanna do so on social media, we all they contribute with the talk. I feel target group people and the layman in a salon where they don't get access to them. Technology, mobile phone. So I just want to know if na program they on WhatsApp.
Well, right now we share the link them on WhatsApp, but we are in the process of compressing the program. We go there specifically for people that we go on for listen after we will get an audio format of them. So that's coming soon.
Yeah, that's very good because
Kumba,
this question, you know, all this work they do so on social media. Yeah, I think na the area where they. Because all this owner they do so, it go fine for making reach the real people the owner they advocate for. You understand?
Right.
Because this government, no matter how much you not talk, then guy they not serious. Then they listen to owner, then they laugh with owner they talk about. Because they already don't get them propaganda machines all over social media. For them, their own aim now for just impress the international world, for let them endless awards than what they get every day, while we then at the ground and they suffer. As a medical person, nobody not supposed to die in a salon because of medical issues. I believe as a Christian that we all get time where we did die. But Boku die the way people in the die in a salon, not to them time don't reach for let them die.
Right.
Now because of simple medical facilities they would not get access to. So this bureau government, they're not serious. We just need for sensitize with people them, just like how I don't say when they tell for reach to the WhatsApp side of our program, so that the least man at the village make we sensitize with people them. Let them vote against them people and come 2023. Because the Mother Bureau regime, no matter how much you not talk, no matter what you not do, they get them propaganda machine employee the way they do on social media all over for the capture their information they are and for the make una own show and look counterproductive in a way that then get all the resources they want to talk about, then use as them propaganda machine for outweigh your own hard work.
Right, but Kumba, one thing we go say true no get son name and true no the lie. That it's and the last. You know, you cannot propaganda on what's reality. If you say we get sufficient electricity, then somebody allegedly die in a hospital because electricity no dey, then they tell the story. Not to wait me say the reality. Yeah. If you say you want for your hospital be like the NHS na the United Kingdom, where possibly you been get service from and you enjoy the service, but then you not get mine go na the Connaught Hospital, they're not to me they say that one day, the reality. So not scared about that. And we know they're against government, but we they talk about the issues that we know they go right, where they affect the people of Sierra Leone, and no one will stop us from talking about those issues.
Especially where we see how this current government we come for fight corruption, we see data from the African press about how billions of millions of dollars when they thief now the government, then they enjoy for fly out while we people and they suffer a very, very unfair. Then they take of people that it's rates, they ask full. Alexa grumble say wait to get one bag. That make people in the dance for Fatima Bio. Because the people in rights, they don't know what's not in right, they don't know what's not in entitlement, but it's not their fault. Now because of the illiteracy rate we boku na the country.
All right. Thank you.
Thank you.
And obviously, one of we call, I don't highlight that the people may not be educated, but then get common sense. So people may understand what's in the happen. Thank you, Kumba. We appreciate you calling the support. Continue for sharing to as much people as possible, okay?
Okay, thank you.
Have a good morning. Yeah. Right. Well, to Femi, Mr. Palmer. Come over to you, then we go. If call come, we will put them on hold until we hear your contribution. Or T-Boy, if you want for coming, you hear the callers, them, you hear the concerns, and some of them just brought us to talk and done some new information because, okay, Femi don't come. May not be no say actually 9 people and die inside 1 week. So that's scary, and then we don't hear the same issues. That remember we talk about Putloko, right? But now we don't talk. Somebody don't can't tell about similar incidents. We don't happen Abu again. Simple, and minor things. Them not did it. You talk first aid kits. If person walk into a hospital, the first 15 minutes, means a lot. whether that person will survive or not. Who wants to go first, Femi or T-Boy?
Femi, me didn't the queue, eh?
Okay, all right, Femi. I can hear you, Femi.
Juma, can you hear me? Yeah, they ask him. Juma, they hear me? I talk about
yeah, they hear you loud and clear.
Thank you. So, yeah. So, you know, Juma.
Yes, please.
Sometimes una they can like what they can see.
All right.
But, you know, we have to call a spade a spade.
Okay.
I said earlier on, say, literally the buck stops with the captain of the ship, or we leaders them. You say you directly put them in the direction of the leaders as well. You know, some people then say the president himself. I don't remember if now you or some caller or something. But, you know, going back to what T-Boy say, I want to actually say something in this case, not to the president in fault. I want back Mr. President Bionaya so today.
Okay.
I believe, say, yes, although he's the captain of the ship, he get some kind of responsibility for him, but I believe, say, this incident, not they solely down to him, and possibly, you know, to the chief possibly responsible.
Okay.
Well, then let me get my notes. Make I get the exact policy why they talk about.
I they wait for you because at last you don't find
the chief medical officer. I think say really and truly, then for go beat in the motor down and drag this man can treat and can question him. He is responsible for what happens in Sierra Leone's medical centers. Yes, he gets in boss, he get for go see the pa. We understand that, but it is your responsibility for ensure say the thing them the resources we then give you for manage and manage properly. And if you need more resources, it's down to you for go ask for them and do everything possible for able to get them. I don't know his name or her name, but the chief medical officer literally he don't let in colleague down. But as I said before, not so because doctor died today, make we for all for the Allah. We for the Allah every day. And the doctor then back, get for be responsible because then for the Allah every day with we. Because as T-Boy say, today now I want you, tomorrow it can be me. It can be your family, it can be you picking, it can be your mama, it can be your papa, it can be the same doctor then did their own people them. We need to start taking ownership of the problem.
All right. Agree.
We get hold on, Juma.
All right, go ahead.
We get petrol problem. Even if the government buy petrol for that generator day, trust me, Juma. Where they ready for lighter generator then at the hospital day. I bet you anything petrol go be missing. That ain't not to the president in fault. That ain't the possibly responsible for that generator in fault. Because instead of them go pump the petrol inside the generators until they don't go pump inside the motor car them. Or they don't go sell them. This problem here, so now we boku get this problem. We say we sit down at the diaspora, we will not tell the truth. We're also just as guilty. People and they say, oh, when I turn this to make politics. No, it's not politics. Somebody say, oh, now I'm begin to talk about this. Not now I'm begin to talk about this. If they know some of we don't begin to preach the entire so years ago. But guess what? I can't do anything with it happened years ago. Well, the family will die untimely death them. Yeah? But we're not going to go back years ago. Let's talk about what's currently in situation. If one begin blame the Skasa government or the Momo government or the Sheki government or the Anes government or the Pakaba government, or one blame them, we will keep the blame them and not do nothing. Let's hit the nail on the head. Right now, we hospital them, they in a state. Then they in a state and we need for fix them. And we all, remember Tintibo been a talk, but the doctors them? So me they even go one step further. I say the person responsible for the generator, because I bet you anything. Say nothing go, no good did it. I know, but what hospital where the NGO they don't build the hospital, they don't do all things for equip the hospital. Water, they say they get water problem. They say they know they use this pump here soon. We then go dig and go find out. The man go talk say, oh, how the washer be under Hamburg. In the wait for make government send replacements car. Really? I see boys say that like your place of work. It's your place of work. You should be responsible for that. Washer, then you go if you pull on your pockets, go buy them and can replace them and go demand your money. There's many things. We not get defibrillator then now we hospital them. I know that for fact. You know, I ask then say, oh yeah, then get for take back, go take defibrillator in that car now this hospital. It's our country really needs help, but you know, we all need for wise up really. As I say, we waiting at diaspora, not so the way they talk about no more. We serve not the help because we they subsidize the system. We go to work, we earn our hard-earned wages, and we support people them. You know, when they say for buy blood, we send. Anytime person go hospital, they want blood. And most of we in the diaspora, we get this demand. So we have to, you know, support. We can't not say we know the ape. You know, Tiboy talk earlier on say I am his consultant. But it's true. Tiboy relies on me when he's in Sierra Leone, if anything do, and because he knows say one thing I'm good at is research. And for engage people that we close, you know, we get a big network. So if I talk to Tiboy every day, something do he no say, wait, don't tell me this and that day. I will go, I'll do the research, I will contact the right people them. Look, almost medical people that we get now we community na London. We cannot say US. We get family them, we a doctor, we a nurse them, we get friends them, we get girlfriend them, we get boyfriend them, we get partners them. So really and truly we get a massive thing we can call from. But I think say the people them we're responsible for the hospital and they take them thing and they for granted. You know, if I know say if I hold this person and each time I want something from in people and they send from abroad, which I go keep doing. I go keep the whole and also because it's a cash cow. Money go to come for me. But sometimes if we stop for provide, sometimes the people that we responsible for the healthcare system them could try for make them put the money in the right places them. Because as you say, why not they go buy SUVs them? We will not get defibrillator them, we will not get CT scans, we will not get mammogram machines, we will not get nothing, we will not get gloves like girl called just on the talk. We will not get anesthetic. Really and truly, our country, you know, it is sad. The last I go Connaught, I mean for cob, I could not stand the smell. The place is smell. I wonder, I ask the one person they work, they say, man, no way, but Andy, we don't embalm. Inside hospital. Anyway, I'll go left for now. There's a lot of things wrong in Sierra Leone's medical center.
Thank you so much. Before I go to T-Boy, I want to challenge you a little bit. You're right. To a large extent, we all get responsibility. T-Boy, read that first paragraph. We all have rights and responsibilities. I only read them. I like that paragraph. You know, I think we get for time to make somebody do a voiceover on that day. We will play them now program and say, is this true or not? Are we following what the president says? Read that for me, please.
Citizens should understand their rights, roles, and responsibilities, why it is important to abide by rules and laws, what equality and leadership mean, what public accountability entails, why respect for diversity and national cohesion matters, and what it means to care for the environment.
Right. Thank you so much. Femi, you know, what's make a challenge again for me. for say, in as much as we all get responsibility and we all get for be held accountable, our president says that we all get for know waiting equality and leadership mean. Yeah. When most of the appointments that we see, then say it has pleased His Excellency. Out of 7-point-something million people, me, His Excellency, I choose Mr. A, say he go do the best work for this. You know, when he come, he change everybody. He says, tell we on a town hall meeting, say, he not they work with somebody who not trust for them and not sabotage them. So he appoints people where he thinks, say, getting interest, they serve in interest, and go do the best job. So they brief our president every Wednesday in a cabinet meeting. Cabinet sits on Wednesdays every week. All the ministers, then they come with them updates and reports, and then can and put their agenda. When we president ready for going to parliament for Gida Babala speech we giso, every ministry come, they write for I watch, I read, I understand. And he was proud to report to the people of Sierra Leone, my government inherited a decade kind of this, but my government has provided sufficient electricity for Freetown and Sierra Leone. But people die in a Connaught Hospital because lights not there. Who that the box stop with? Let's take, for example, God forbid, Mr. Palmer, God forbid, if not the president, any of the relative them, you know, be fall in that kind of situation in a Connaught Hospital. If I don't see police, soldier man, then they don't go, they don't beat people them inside there, they don't arrest people. And just like I say, we not get for wait till it happen to we before we act. So it is his responsibility. If they listen this program, or in people and they listen this program, we'll go share with them. He don't tell we say, if they see, know everything where they happen. He did his media talk. Some of the things that we report, we not even know say you're aware. He call people by name and this and that. He relates with issues. So that means he knows what's happening. You go sit down. The person who is responsible for let lights not in at that place there. That the hospital. Let it survive the next day. Let it sit down there, not call him to query. Mr. Paba, where you the work? Who say you the work? God forbid you have an event. Lights go. What happens to your job?
Well, for me, not a community electrician.
You're not an electrician, but you as the manager, what would you be asked a question or not?
So and I say we are all responsible. I'm not saying that the president isn't responsible. So as a manager at work, if something goes wrong with my team, I am responsible. I am responsible for the technology of things. And obviously technology depends on electricity. So if electricity go down at the building, yes, the event fails and I am ultimately responsible. This week I do a VIP world-class event where almost I be the person, I can't call in name. Naya. But you know, we had a few issues. But guess what? There is backup and backup and backup. And also the issue what we get is also minor.
And not a life and death situation.
Thank you. And the good thing is nobody in the audience, nobody in the panel, nobody apart from we where they inside the control room no say something happen.
Right.
Yeah, because straight away we go into contingency plan.
Right.
Yeah, we get, you talk about electricity. So in this side of the world, we get something named an APC. So when our system, if power cuts, it go give you power for 15 minutes, 20 minutes, depending on whatever. Say the generator they kick in. So there's make I say there's lots of contingency plans. So by the time the power go off, now the event space obviously lights go out, but the equipment them will still be powered on by the APC until the generator comes on. Then all thing will come back on, and literally all that need for happen within I don't even say minutes. Maybe just over minutes. But as a minute engineer, I don't know what's not their own response time. But what I know is the equipment to me they manage. If power go off, it will come straight on within. It won't go off. My equipment will not go off. It will be connected until the generator kick in. Obviously, the generator not kick in within half an hour, then it will go off. You understand? So the point I try to make is there's processes in place for make the entire to happen. But as we know, Sierra Leone, we're not very good at processes. You know, whenever somebody can put processes in place, then say, this is things is a bit too much book. And these are all the little problems that we get. Then small PCRs on in the full bid. We know they realize say you know
they don't talk as one now.
Exactly. We know they realize say these processes are there for not just for cover we assistance, sorry for my French, but for help so we not go able to reach critical condition. So those are the things. But you know, as I've been saying earlier on, I don't really want to blame the presidents too much. But I think say really and truly there should be an inquiry. No, hold on, let me finish. There should be an inquiry about what happened. Yeah. And as I say, for me the chief medical officer should be brought to task. Yeah. And if you know able for go and find out what happened and hold the people responsible, then he's not doing justice to the people of Sierra Leone, not doing his job, and not doing his boss any favors. So then that means to say, in boss the president gets affected as well.
Because go ahead, sir. Continue.
I know cases them. I will talk about one where somebody go hospital and then realize that person needs a doctor, then call the doctor not show up for 10 hours.
Right.
Yeah? Doctor not sure for 10 hours. I don't care how big free tongue be. Yeah, you tell me that doctor go day where he not show up for an emergency for 10 hours. By the time by the time the doctor come, the person don't die. I know.
Because doctors they're not there.
Thank you. I know another case now 34 because I actually go hospital for go find the woman. Yeah, Okada. Yeah, it's such a sad situation. Somebody thief Okada. Or not to say thief the Okada. You know where apprentice cannot take, where the main driver and he don't pass and get apprentice. Apprentice don't take this thing. He not ride down. He not sabi ride this thing so fine. This woman can down keke on the other side of the road. Not outside the Okada the on the other side of the road, the Okada and lost control under. He can bang the keke. The woman the can on the keke. The keke obviously you say keke not get better with it. The keke go jam the woman for them. Then can carry this woman go hospital. He complain chest pain. Then carry this woman go. Then can go 34. At 34 in the military hospital, 34 in the military. Yeah. Then can go 34. So literally, I got the call. Mid England and called me. I was like, okay, you know, we send money for me, then go do whatever they want to do. I was going to Freetown anyway. I ended up with Freetown 2 days after this accident. Imagine, I go Freetown, I not go the next day, I not go to the hospital. 2 days later, now, you know, I say, because now, you know, now somebody they work for we now, mama. So, you know, we go look this woman now. So it's about 4 or 5 days after the accident, he still not see doctor yet.
4 or 5 days after?
Yeah. She ended up, he died a couple of weeks later. Okay. Internal bleeding. So really and truly, now I can say we're all responsible. We are all responsible some way, somehow. They say some hospital then where if you go, you get keke accidents, they not even treat you. Because they say, oh, now you go find out for you. It's not keke accident, Okada accident. It's now you go find out for you, go see some pants up Okada. But not all my we get Okada accidents, you don't pants up Okada.
Right.
We know how some of the Okada in the ride around the country. You understand? So carelessness, you're supposed to be a nurse. You're supposed to be a doctor. Now you get responsibility there and there.
When it comes to the negligence side of it, then we come to, you know, not their own work. But this, we're talking about infrastructure, for God's sake. Infrastructure for the country. And then proudly say, we get in abundance as well. So how comes person die yonder because of this still in abundance? So I want to keep us to start with. So I'll not go blame anybody but the top, because if you don't say no, they tell people and say no, they, simple as that. If you hold you people responsible where it please His Excellency for appoint, then you hold how you been pleased you for appoint them, where they don't cause problem, people and they die. Now, so if for please you back for get rid of them. But of course, them all, the deputy minister, all a medical doctor, he beats them before people all. Waiting commodity. Both case. See, boy, over to you, sir.
Finally.
Yeah.
I get 2 text messages then for read. Again, they're straightforward but controversial, but these are text messages. It says, poor work ethics in the health sector and in salon in general can't blame the president. And the second one reads, doctors on duty are never available. You will call a doctor and wait for over 7 hours before they show up at the facility. Junior doctors are running private facilities. The next one reads, government said free health care for pregnant women, lactating mothers, and children under 5. How many women have continued to pay for services? The health worker asks for money. Who do you blame? People do not report, and therefore makes it hard to address. So these are a few text messages that I got on my phone, and now for just like we able to highlight some of the concerns. They say this all the time anyway, since we started the program, say it's joint responsibility. And I still stand by the word, say it should be joint responsibility. And also, we extend all our sympathy to those that have died based on negligence or for the fact, say, we medical facilities not structurally structured for make them able to deal with the issues they would get. With some of them are very minor issues that we can be done in any part of the world, backyard hospital, if I would say so, worst. But I like people understand one thing. For make we switch and quickly say we are politicizing stuff, are we actually living in a country now that you don't really talk against or for anything? It has to be politics. That's one. And 2, are we still going to be looking back at the decades of the APC government, whether bad or wrong or right, or what they did was rubbish, they're thief, then this, then that? As a moving nation, yes, we don't forget about the past. We should learn lessons from the past. But we have to deal with the current situation that we find ourselves in right now and make the future better for we offsprings that we will get in life. Because if we continue to live on the past of what not happen at Salon will never develop. Salon will never grow. People will never take any form of responsibility for their actions because we still live in the past. Politics is a way of life. Every day, everything that we do is political. In Europe, in America, in Canada, in Australia, in China, in Asia, everything that you do is political. You might not consciously think what you're doing is a political decision, but every move a human being makes on earth has political connotation at the tip of it, whether consciously or subconsciously. But we should stop singing the hymns of politicizing things that are not really necessarily related to being politicized, because it don't make no sense anymore. We cannot be singing the hymns of the past government's issue. If the Anescoma government do so bad, we're not able to hold them accountable to that. Some of we not stop talking. Some of us will be still the talk, but nobody listen. Now we still continue to talk. Everybody's listening, and people are saying it is political. I beg, please, let's find something to do in our lives that we think is not political and see how we live.
Me know they apologize for them.
I'm not apologies that they make. I am not making any form of apologies. I'm just making a direct statement.
Right.
So as far as me concerned, salon, we need one thing for make salon change. One game thing. If we able to say the truth and live with the truth in Sierra Leone, we go begin understand what is responsibility. Because that are the one big problem for so gets. Nobody know how to talk the truth. Either you know how to compromise the job, you know how to compromise the relationship, you know how to compromise your family, you know how to compromise who's how you feel say you dey eat. Because guess what? If you say the truth about what thing you do or what thing they go wrong in that particular area, or that particular side you say that is going to be the end of you. So be it.
Yeah.
So be it.
Okay. Hold
because
on.
Guess what? Some of we for don't sit on a position of anything right now, and even before. But now because I am not scared to tell you what it is, how it is. I need to disrespect you. I need to curse you. I need to tell you what we know for your I've never used an abusive language in my life under normal circumstances, except otherwise, because we're all humans. There are times when we stretch our mindset, we stretch our emotions, and we stretch our actions. But I'll guarantee you, if you hear somebody say, T-boy say this, first self, now no one day first self. For let you say self, you don't see T-boy first. So we can really be mindful of how we switch things. Yes, I don't want to first. Who said that first? I don't know.
Hold on, dude. I will come banter, but if I have a caller on the line right now that's been holding for about 4 minutes.
Well, I made a good beat you in a Shakasimi Stadium.
Now the different not of first. Now make the good one beat you. I'm not saying you say I don't go first, so me they can beat you. I make the one go beat you. Let me to say first too. Okay, Juma, go Nicola.
Hello, caller.
Yeah, hello, Juma.
Yes, and I will speak up a little bit. Your name, who side you call from, and your contribution. Make them.
Yeah, me Ahmed. Yes, I call from UK.
Right.
Yeah, I want to say when I thank for telling me thank you so much for watching. I do. I think the contribution and with regards to the health issue, just like what the Femi say and T-boy says, I think they all day in place. But like the last speaker say. You know, now honesty and sincere people are not sincere to the jobs the way we do. Especially when it comes to the critical job there, my brother. I tell you for free, I get some few of me guys away in at the medical side with the workers, nurses and stuff. You know, they're not the whole blame of it. You know, this is not a politicized things like what you already say, not true. But now the leadership gets problem, my brother. The leadership, because today this guys say one who say they work at the nursing sector. There's a lot of them I know. Then they collect bribe. Then they look for people on the couch, picking, sick, and this and get a small thing. Imagine that when you pay and they pay you when the month end. But where is the money? How much money they give them? Poor salary, what you expect? So now. So then
they buy sick, man. That's what you're saying.
Then they take money, Juma, they tell you, imagine waiting for work for free in America, where we say they receive salary, back over the couch in Piki. Because I guess some of me free where they then under 5, then Piki, then get some really at the other higher side. Then all they collect money just because of the salary poor. Government will pay attention to them and look at the billions of money where they disappear. Now the problem this is what we get. Now the problem this is what we get at that sector. The medicine they wait for buy, they go buy. We undergo a lot of things. Some of who go to family and they do when they sick, when they call you now, they look at some minor issues there, minor sickness there. But this is the problem. Sincerity, the people are not honest with them, job them. Sierra Leone don't sound like I don't understand how the system is. Because I can always compare. Anytime I talk to now, I can compare little Gambia.
Right.
While they're Sierra Leone, I work there for some time. The educational system don't improve. I don't work there as an examiner. If I look at the performance, you are the night, they know that they do better. Look at the medical sector. And if I tell you, we get a lot of qualified nurses at that country. We are in the head, the private sector, and other areas in the hospital. Imagine how far I don't go before we now. Because they're honest to salary, the chief under, the life and medicine. If they catch you, you get problems. Salon today, doctor will prescribe, it is selling a pharmaceutical for go buy medicine. You know, they happen and then coach the day. Imagine how they manage to put the system to that extent. We coach of all. We not corrupt system. Because from the top, the brother, now from the top, look at the doctors saying and the language. So if the doctor is dying now, so what about the poor person? We don't get anything. We don't get any. I guess somebody wait for good do medical operation. It even afraid. See after the madam will see how things go. So then go diagnose again. They get some pain medication. We'll see. People are afraid for even good hospital because like a death trap. They go buy die now for yourself. Now the system, people are just corrupt the system, take money, eat, and they come people and they continue for suffer. You know. Anyway, this time it's like things are going to the worst. But this sort of politics again. This government with all what they talk, all the promises, all about this, nothing not functioning. Nothing. Some of you get people there, me brother. I'm not just call. We don't say no more how we talk. We don't name those such people because they say if not labor and they work and they. Although sometimes I don't want to blame they say because some of we the irony is then guy they are where they operate now we continue so they don't live so we don't do so now today. We then continue at least if for be honest if you can you know if you even in a job you know the lie because line a big thing everything is digitalized camera so you learn for the truth you know the learn will look there today majority of them could be in common that they go and it's like they just go try for do the people they're not too honest to the people and they lie publicly you know they mismanage the offices then they not the position of trust they give them they know they function well these are guys who don't live in the West imagine they don't live in the West they won't go corrupt and back with people who they meet again so everybody just got now they are above the system brother now corruption people in the institution for it they're not honest to themselves so man if you see which are they get little you want to live beyond that so you get for the sell people the right you get for the sell people the medicine you get for the sell government property there but what is the cost that all and the system will not in place because we then catch you we then discipline one or two and things they place so we the month on salary they get they hope for get salary you get enough money salary we will look after you say no go do corrupt things right but when things already in place so now this is the problem brother medicine they sell people are not get away for buy so how the poor man goes continue for suffer. Now this are the thing. This system now rotten. The people are with all the which they talk, the brothers, they not do anything. We just find a way. This is not politics. Anybody we can again. At least it's high time we happy because social media all long people don't give the platforms they will at least we will talk to the people and they will listen and they will see what we will pick up next. We'll continue for this. So now we the last right now West Africa. Now we the last you brother, we the last. There's small country, even South Togo, they are island and they better pass along. I'm telling you, brother.
All right.
So we need to get changes. We need for change. We need for change this time. The changes now one this time. We go for really ready for that.
Ahmed, but when I be so now one change, you get changed now that 3 years back when I saw now.
No. The changes we now with the now formulation the whole system. But somebody like me, we at least I know. When doing at least I didn't do a day school by then they doing them kind of leadership and I'm not believing you feel see this government if there is gonna be changes I be thinking about someone even not so APC or that person but not to this because I know this guy if you look at the trend look at the history people then just do mistake stupidly look at the history of this guy when this guy go Ghana my sister in Ghana before he go Canada this guy brother mother you this is brother then when during the war, when they pull out with me before they are in travel. In more than they go take my sister, pull leverage for all them money it's different nationally than go poila. So that kind of people they cannot make no progress, no development. You know, and any 10 people say for work in the country, you go back and see one leadership. People are stupidly enough again and give this kind of person power. We don't bet your money, go come abroad, go and cash don't not do nothing, go back, they will not get power. And they mind in Ghana, they will enjoy with your family. Now, Ghana, I say, my sister, I don't even call me sister. My sister is having grad. When I mean, go take them, go come buy this, that, enjoy money. That's what they take for them money, what it's for. They kind of people in there. They kind of people in there. And my sister, because you know, they move in it, and then our friends, they even at the operation side. But because they all been big Ghana, they employ money, so they can much money. Now they go take power again. You take power again, you know, go change, me brother. You know, go change. So me, obviously, I not be get doubt when I just say no anybody will go, but not I not be the exception that kind of person. Or no putting fishes. Some people will be opposite and say will change. No, you know, will change.
Would they join the president for pray let God give a good leader?
Yeah, because if we don't get 2-3 people away for don't invest or something, how many factories we get at the eastern part? Nail factory, then factories, they all don't die. Who shall we come up from them local side, they sign this, all the small. Can you imagine where they come up? All they sign the people in the work, your mind, the work, and now the bubble there's also drugs, tramadol, Nigeria, and unpacking the imports and come, the system know the work, policeman they connive with them. Policeman they connive with them. I get a friend of mine last week, he said they get me call his sister. But I said, what I say is I didn't turn on the phone at the background, somebody called them drugs, and I said never don't have to kill people. I say return and back. If you don't get money, ask me make I send for you. I'm not going to try to forgive if you need something, but not ever. One religiously, as you pray, why they say when I pray every day, when they send that tramadol, they give them what they are, and that side, they want to kiss side in a shell, come they road dead area. I say they for destroy them. And you get small and you boy and they say, where the one they win them you people and say, big brother, the way they give parity, why they see the smoke, and they cut you off. But I don't know they go somebody, they smoke or they drink. So check lots of you, I reach the seller. So you see the only thing in that the plan, the government just make sure that things, the drugs don't float to the country. They destroy the young one. They know they are arresting guy. Gambia with the catch one as a man airport. That guy they wish they keep party. You wish somebody die. You know the Tampa German say drugs they catch you. Come on, when they selling a marriage now dark side. Salon today now you don't turn business. Tramadol and the cow charm. I don't know how much million but now it's real profit. I tell you, policemen they involved. So the mind they involved for smoke that the system not the work, me brother.
Right.
The system not the work. Okay. Me brother, the system not the work.
So the system. Thank you so much, Ahmed, for the call.
Thank you, Juma. Thank you so much.
You know what music we then call the system, something like that.
Man, that's how you work music. Anyway, thank you very much, man.
You not even remember that music they again, sir.
Yeah, but remember the music, man, the system, the money we.
Yeah, not about our society there.
I think I've been young leaders and our society and a mix.
Okay.
Right, okay, I can continue.
Yes, I'll continue.
I'll give you one music as well.
Yeah, go ahead.
If life was a thing, Tibodana for me no.
No.
The money could buy, the rich would live and the poor would die. In the 80s, salon music. On an exclusive voice.
So now forgo Fenam. Tibo, before you continue, I want to let Femi be on standby because we need for show that video. There's a video that we need to show, right?
Yes. And I get me quotation back again.
Yeah, you get a quotation. Because this issue, like we say, not to a cap on a Connaught no more. Somebody else go outside and say, do a video on this same health issue. And like how Ahmed said just now, the system. So the healthcare system, it is rotten.
No, I think you see, we
too much come out in there.
You see when I can start serious billionaire and Africa like you say.
But it's the truth. That's how we are right now,
So what type of tumors are coming out of the system?
Tumors promoting better. It is Solata is going inside everything.
Is it Jacatoin or Gibuloxin?
Gibuloxin. Oh. You have to play the video for me.
That video, man. What you do the video? Hang the video first.
Okay. Be on standby no more. Go ahead, Simon.
Juma.
Yes.
You said what I laugh back so. You see, I am not surprised at the current state at which we find with country right now.
Why?
Because I don't get when people in the talk, I close my eyes and then think back 15 years ago. And I've dealt with most of these people 15 years ago. And we've worked in so many different projects 15, 20 years ago.
What people you have begin name them one by one?
No. You have any problem, eh? I don't like that too. That's your problem. it's not confidentiality. You see, a filmmaker, you can't talk about in work. He tell you the work we do last week. I don't mix so.
I know about confidentiality because there are lots of information, but not mentioned.
But tell me some of the patients that we deal with yesterday.
No, I'm not in the medical field again. I used to be, and it's we are not dying sleep. The facility, wow.
Let I just go no to what I for say. I'm listening. Just want to say, Brian. And what I for say is, I am not really that much surprised because, again, integrity is something that you should have built within yourself. We all make mistakes in life. Nobody is perfect. But when you pave certain ways or you took certain actions towards certain success in certain things in the way you do, and you know for sure what is merit, what is credit, and what is possible influence or possibilities of you being next to the seat of power or authority, we get our game. That waiting game in our system in Sierra Leone, they still talk about truth. Forget even about the reconciliation because that's possibly not going to exist now, but just be honest. Because if you're honest, you're ready for own up and take responsibility of your actions. You take ownership and say, this mistake will happen, so now so today, I should be held responsible because I am leading the pack of wolves that went into a bunch of hyenas thinking we'll be able to break them down. It was a mistake. But if we're not ready for take ownership of some of the mistakes they already make, we all don't do things the way we were responsible for those errors. Again, I own up to something where I do today where I will say, okay, this is again me, then I will fail, and I will not do that. But I took that responsibility because it was my duty to execute that particular task. And you guys didn't even know about it. But I spoke to the person that was in charge, and I made it very clear to that person, my apologies, because I should have been the one that should have contacted you and make sure that ABC did happen. But I didn't do that because I thought you have understood or you knew about the issue already. But now that you've made it very clear for so you not understand or you not be know, I raised my hand and said, I am responsible for that error. My apologies. It make them very simple for let the person understand, say, yes, no problem, T-boy. Let's move on. What the next we need for do now for set up the next stage of what we need for do. Like I then can issue that happen so now salon within the medical system. Yes, president is responsible, but also when you break it down, I always say to people, sometimes, majority of the times, president they even go to the field for check and see what thing don't happen in that particular minute because he have people that he relies on. And most of the time, these people come back and tell him what they want him to hear. Then they can't tell what he want to hear. And now gets for take decision now on your own. Can I go and cross-check? Or can I send somebody else to go and cross-check? Or can I trust these people? But guess what? These are the people that he has worked with for years, so he knows them. And he will rely on what's in the settle and beach, right or wrong. Somebody make mention the minister, the deputy minister of health is Keke Thomas' dad. And we all know that kind of relationship. But again, to be responsible is to set the first example from the people who are closer to you. People and they will don't work with in the past way know the kind of structure of what you do. These are the people who set the fast, the quickest, the most explicit examples too. Because when I say we're supposed to go do this project for the day by 6 o'clock and me turn up at 7:30, I've already missed an hour and a half of that particular project. So basically, we don't begin fail first. So Uda Namina for can begin telling us, now hurry up, man, look, we get this thing done. I am already late. I was not on the I'm not in the venue on time. So all I need to do now for come apologize and see how fast can we wrap this thing up, because I'm already late. And I know for sure I should have been here an hour and a half early. So if we take responsible ownership from the head to the bottom, then we know the friend we self usa. As a practitioner, a professional, Femi make it clear few weeks ago the meaning of a professional. Because sometimes we use this word professional, we think you should be paid some exorbitant amount of money because you are called a professional. No. A professional in any particular work or trade or any kind of entity is somebody who is doing that job for the love of it first. For the love of that particular profession. That's what makes you a professional. You do the work, you deliver the work, you're satisfied with the work, then you will be paid. And at times, if you don't get paid, as long as you know, say, you don't deliver that work to your maximum satisfaction, you've acted like a professional.
Yeah, but you can forget paid if you're supposed to be paid.
Correction. Correction. So I think it's the opposite of a professional. So an amateur. So if you love what you do,
yeah,
you know, I think say in everything, in every career will they set we safe, we get for love what they do. But I'm gonna keep talk done because that's I think that I get for end. I get a particular message I want to send at the end. So I'm not gonna talk now. Go on, T-boy.
Okay. So basically if you think of that particular area of what you do a one for deliver, you get less worry. Yes, you should be paid. But as somebody sent me a message earlier on again, say people and they take their jobs here, so even though they know the criteria of the payment structure, and you know for sure, say you go take up this job, then they go pay you 1 million loans, and guess what? Your expenses is more than 2 million loans for the month. So who say they able for gain the other extra 1 million? Million of people already tell me, say no, I don't want that job because you not get mass. Really? What do you mean by not get mass? Oh, that job in a basic salary, you know money they give you. Wow. I've known so many people that refuse to work for the bank because the bank not get extra. Because if you want to get extra, the bank pass you thief. And guess what? Then it's still thief in the bank. Because when they count your money, if you didn't have the sales side, the cons, and you take some cost UI, now pound something we're not supposed for cost UI pa. Now you comping and self-save now in the thief your money where you count. Then
a salon bank
salon. Yeah, of course.
Okay.
Salon. So then basically they short in you money, and then you get for be held responsible for any money we short in now you until. So we got to look at all the affaf minute thing they answer. We not get no culture of saying thank you and walk away. Thank you. What's in the happy now? So if we don't begin to take certain things then seriously, not to just the health sector therefore go down the drain. Every sector in Sierra Leone is about to go down the drain just because we know they say the truth, we are not honest with ourselves, and then we always cry foul when it hits we now with foot. If you don't continuously cry foul, you don't continuously complain, you don't continuously make your points, you don't continuously protest, even at your workplace. People in the protest and the workplace for how you call them, facilities them where they feel to say they're entitled to. If they go work, they gave us a job in Sierra Leone 7 or 8 or 9 or 10 years ago. You know why we turned the job down? Lucrative job. Because they're not able for take care of one gain sector where we highlight to them. Don't worry about our medical, we're fine, because if something happens, again, the same normal salon, we can jet ourselves out of the country and seek medical, only because you can afford that. But they fail to adhere to just one thing. And then a basic minor thing, when a salon, we need that. That's demolish the contract. But if we be one for be greedy, and we think only for we self, we take the job. And guess what? Oh, take care. We don't care. Whether we deliver or not deliver, as long as them pay also waiting around for pay, and we they go and do what we feel for do. But not to all be able to do that. Not to all be able to that kind of situation there and milk the system and then still sit down conveniently and say salon sweet. That's not how we want to interpret the sweetness of Sierra Leone on the basis of people dying and we don't even care. On the basis of saying if something do make right now, I fly go Guinea, fly go Ghana, fly go China, fly go Germany, Russia, Dubai, and gets medical attention. That's not how we want to interpret say salon sweet. Take advantage of the minority of what you feel to say you can take advantage of. That's not how we want to interpret say salon sweet. You go there, you're afraid for drink water because you feel say if you drink water, I'm going to kill you. That's not how we want to interpret say salon sweet. You go there, you then say, oh, if I'm sick, even professionals seeking jobs in Sierra Leone, they will tell them don't. If you're taking this job in Sierra Leone, it is at your own risk because the medical facility there is zero. Medical insurance need to cover you if they send you as an expert for work in a salon, except if you work for the UN. But if you can see, when you have the Westerners working in Sierra Leone, their flights, they always be ready for take them out of Sierra Leone. They need to joke with that because they know for sure, say, we lack so much. They can't tell you, say, fix your problem. They can't and do what they feel for do and get out. They have their own hospitals, then they fly in their own doctors, they fly in their own medical facilities, they fly in their own everything. You will not see it yourself. But their embassies provide.
Talk to T-Boy. You know, side the medical evacuation people and they get placed na Saluno.
Of course.
But na Liberia then they.
Thank you.
Aspen is in Liberia. When, there's any evacuation, then they fly in, helicopters or whatever. Liberia, Ghana, and they. You have a Aspen hospital in Sierra Leone, but they not get the, what you call it, the evac, then because we not get the facility, then salon them. We found in the Liberia, we emergency. So imagine, say that they feel that plane for can't take somebody care and go Ghana or other place for go stabilize and force before they begin care and go other side. Because medical evacuation, you just can't, because plane available, you travel with the person. You have to have clearance for sure, say, you're able to stabilize that person until he reach now the receiving hospital.
Of course.
If the receiving hospital not ready for take arm and all that thing, then they not get insurance. If insurance not, if na private pay, how much you pay all those monies, like for Canada, United States, for example, you have to make sure so you meet all them criteria then before they pull you. So no matter how you get the money, you can still die if you not get the immediate care, like how you say earlier, the first 15 minutes.
Yeah, of course.
Makes a huge difference in your life. So now make me they say, we have to do a lot to improve the system in Sierra Leone. We are not saying all this talk what they talk now so because we hate the system. It could be me, T-Boy, Femi, or anybody. We go sick. Femi talk about something earlier that we are aiding the system for go down because we person sick, then call we will send. Yeah. But the first instinct for you is I don't want to feel, saying I'm irresponsible for that person or that. Even if my enemy self then call you now, say that person they die, you na fed this, that. You go grumble, but you go send the money for let them treat them first. Because you don't want for let that guilt stay work you. My family member will not be sick and start asking questions, now go tell the government go na blood first. No. I want to make sure they are alive first, then grumble or ask questions later. So now make me they say if the system, the one that we're responsible, not capable for put them together, we for kick them commodity. But I agree with you now equally say, you where they serve, you're not just there to do the job. You have to advocate. Say these things has to be right. You know therefore wait to let one of on your own be affected. Because like how Femi say, if you left your backyard dirty, the breeze will fly the dirty car inside your house. So clean them at all the time. And member say, I work na a medical facility now. And I never know say, I'll get for need and service other than for go for regular checkup. My daughter was sick, the vomit and all that thing. I freaked out. Who's having here for end up Krango? Now that same facility there. Imagine if waiting me supposed for do. Now I am a patient because my daughter is a patient. So imagine if I not been don't do it I supposed for do for make sure say me patient and feel welcome. Then now when me go, I want all that waiting colande. Even where I get for wait, that short moment they were I get for wait. It was a struggle for me because I remember me picking in life waiting for happen to her. So I start putting myself now with patients them shoes. Say, oh, this is what they feel when if they come here, then they block them a gate, they not wait them for later, then spend more time for wait for see doctors. So my role would be to advocate for more doctors for the Nawi clinic.
But Juma, 13 years or more ago, me picking sick na Freetown family. Now bike would therefore right because that would be the fastest way to get to 34 hospital. I therefore see them me open pandak till and rip down. Pandak, I can't afford nothing other than he just needs to be given drip.
So dark that they give the person.
Dark.
So imagine if that person maybe needs something else when
Well, that's all I say you should done how they bury you so well.
By force there. Like how Ahmed say they go buy you won't die.
No joke. Again, because the health risk in Sierra Leone is extremely high. Extremely high. Because I'm thinking it's you need to go friend them. It's around you. It's around you. Now only God normally save certain people in life now alone. Because medical concern is all around you. You dey breathe them, you dey walk in them, you dey sleep in them. Everything you do in Sierra Leone is not medically safe. I don't care who's kind of you dey. But the moment you leave your house of comfort, sometimes you say house of comfort say we dey feel to say everything they do is still healthy hazard. Because there are certain things that way then you do wrong. Certain practices then they way wrong. Imagine you get generator, you light them all, you smoke on all day. You didn't say house lock.
Because if we learn not to the generator, so you get the generator inside.
Thank you. You get the light so, but guess what? You dey inhale a lot of toxic into your system. Then 2-4 years down the line, they say you get lung cancer. You begin wonder, so failing to realize you don't exhume so much smoke into your system, it don't clog your lungs there. So we they even live inside comfort at the same time, now slow poison will they give yourself. Because at the end of the day, we don't even know what they do. We don't. Can you imagine? You just think, I know the place us, you put fan by yourself 24/7. You give yourself excess cold. You don't need that amount of cold in your system. Because the place hot, so it means you for freeze yourself down. Guess what? That's not how it works. And then 2 years down the line and say again pneumonia. Also I pull out, but power salon hot so your comfort is even leading to your own death in Sierra Leone if you not be careful. Just because you feel say no more, I get the money. I want to live comfortable lifestyle. I want to put AC on 24/7. I want to make sure say fan blow me till morning. Sometimes all of that is not healthy because they at high risk. You don't even know what's in your health condition. You don't know whether I need enough heat in your body or enough cold in your body. You just the pack and no more go. Just because you need the comfort, you eat now all the restaurants 5-star. You don't even know who's kind of lobster in the guess how long you don't in a freezer, how long they're not supposed to cook them again. But you just go, I need lobster. You don't know then a fresh one. Your money is actually putting you to slow death, even in Sierra Leone. So there is a lot we need to learn about how we feel say the healthcare sector can be better. We cannot fix it. We don't have the mechanism to fix it. We can only talk about it and highlight some of the concerns they will feel to say needs to be highlighted. Hold people to be responsible. People should be in the position to say, yes, we have made mistakes. There is nothing wrong with making mistakes. The only thing that is wrong with making mistakes is when you fail to learn from those mistakes and you don't allow them to occur again. Then you're not learning. But we get for really try for like we change the ethics. We change the modus of operations, how we practice. If we not get the right tool, you cease to practice until you're supplied with the right amount of tools needed. You cannot build a house with just a spade. and a trowel. You can't. Because those two tools alone cannot build your house. You need other tools, except if you want to build tekefeke house. A couple of years ago, we were hired to do a documentary. Not a documentary, a TV commercial. And guess what? They've searched the whole of Freetown looking for people who they believe. These are foreign people, Kenyans. They were in Sierra Leone. They want to do a TV commercial for a mobile company. And they were looking for professionals within Sierra Leone. And somebody said, oh, I'm not in Ghana, so. Then they up Wesley Street. When I called them back, we were just about to fly out of Sierra Leone. Christmas don't send me one for left for camp. Now they reach out to it. Eventually, then friend, I only show them one thing. I only have one element of what we have was just my laptop. My laptop was a Mac, and we were the first. I'm not gonna say so because one guy will go fix everything our Freetown and say, "Oh, you guys seems to be the second person with an Apple MacBook in Sierra Leone." Oh yeah, what do you make you fix then you're the first? Only because you don't see video now, so you fit this now the second and you were the first? No, you're not. Because there are many people who own that stuff in Sierra Leone. But guess what? They don't brag about it. Just like you and I. So basically, we were only given that job because we have the right tools. What was the right tools? These guys saw us with a MacBook 15 years ago in Sierra Leone. Not 15 years ago, about 10 years ago, I think, roughly about that time. They saw us with a MacBook. That's the only reason why they gave us the job, because they said, oh, you guys are, you know what what you're doing. Just because we own a MacBook and they now look at what we've done. If we have the wrong tools, imagine they've gone to so many different media houses, but they were not satisfied. So just get the right tools. You will not suffer to do the job if you know what you're doing. You can get the right tools. If you're not qualified, you will not be able to deliver. But these people have spent 10 years of their life studying, trying to be the best doctor that they can be. And then when eventually they finish, they're qualified, they have the wrong tools to practice.
They don't have the tools, not the wrong tools.
Well, they don't have the tools to practice.
Because electricity,
miracle, they are not God. They can only do things with what is provided to them. You know, they go tell somebody to go drink aspirin and a codeine you get. You know, they tell somebody, say, oh, they can't do operation for you, but lights not there. How can you perform that? Only my uncle that did it 30 years ago. Only my uncle.
Okay, that's not Pepe doctor business.
No. Well-trained and qualified doctor from Germany. He came back to Sierra Leone 40, 50, 45 years ago, and he was the first and only person that I saw that actually did an operation under COVID. Because the atmosphere was conducive. It was cold. Okay. It was like a freezing temperature atmosphere, and that is exactly what he needed.
Right. We don't know about that case.
He performed a surgery there, and the patient survived.
Yeah, well, depending on the case and waiting at the surgery.
I am just saying that not for any kind of reference point for say yes, it can be done. But it's not a reference, but I'm just saying that my uncle was the only doctor that did that.
My uncle was done that. Okay. And
your uncle what's the problem, man? And they both say my uncle and the only boss you don't do that. What's the problem? I don't like so.
And your uncle no they follow us.
So I take the glory for them. Yeah. And I can say that with honors, and I go raise me up and say that with honors.
But what's in that show? Now, waiting the callers, then don't say that we have good doctors.
Of course.
But under the circumstances where they even able to survive, there's a lot.
We doctor then get a serious brain drain way kind of this country 10 years ago. They are professionals in this country, in the UK. I know them by names.
Mm-hmm.
I know them by names. And then they do extremely well. You know what's happened? When they come, they only have to do 3 months adaptation. You know why? To get them familiar with the tools.
And the laws.
That's it. Yeah. Get them familiar with the tools. And the operational materials and equipment. Then this is what we were talking about. Now this you don't learn what. Now this can teach you. This now this. That's all they need to do. 3 months. And that not only go for the doctors, but for the nurses as well. 3 months adaptation.
Dr. Walewe Daiso worked alongside doctors the way we fly with Go Salon. Him and his colleagues, them. These are all young doctors.
Of course.
About 6 of them where we go because we whole team not able to go in time because direct flights not be there. So then we get for cancel them flights them and we own mission don't start. So what we did was to work with the local doctors and some of the doctors that we don't go at all. They worked. It was exceptional. This guy volunteered his time in money. We will not pay him 1 cent. 1 cent. He helped
we really have to look into the system and see how best. To me, I think it's just to create a lot of awareness on the seriousness of a health issue we'll get in a salon, so people should take action. People should action things. It's not just about saying these things, talking about it, but they should start to put them into action. Okay, let's visit. Pay visits to these places. Una go visit them place they are. Don't just sit down and say, I'm the Minister of Health or Deputy Minister or Director of Health or whatever you might call it, and you just sit down behind your desk. For your boy work, they give you delivery.
Then all the money they waste for go visit petrol. If you not say you need air condition inside your motor car, you need air conditioner use. Now electricity and a petrol now get for use. But you want for tell me say the hospital pass, you go visit for let them go by the time they go, they don't go take all the bed sheets and they don't put them, they let it look like I say waiting. You ask yourself the question. If I sick, I go on for let them admit me now, yeah? If I sick or my person sick, I go on for let them admit her now, yeah? If you will answer that question, they say yes, then the facility okay. But for as long as you the question, you say where some people can make reference. I'm sorry, I'm gonna be using this derogatory comment. Say me dog self and no one for let idenaya. If you can say that, but you say the people not for talk, it's a okay system. They're too late for politicize things. Them now today the problem starts. It don't start from 19 Jubilee. Like Femi say, we can't be talking about what has happened. Now that make them change in the first place. But if they can't change the way it happened, I don't take we 60 years go back. Then why not do not get for commodity? You say you don't go hospital, you don't go NHS. I make you mention NHS. I want you don't dream and big NHS. Connaught Hospital. Connaught Hospital. See, boy, Connaught Hospital, if you touch Connaught Hospital, you can put them now UK.
But Juma, on a very serious note, on a very, very serious note, regardless of all the practical, the private practices they were in a salon, Connaught Hospital still remains to be the best in Sierra Leone.
But I'm not the best. I can say that
it still remains to be the best in Sierra Leone.
The best
they get the best aftercare. They get the best doctors. The only doctor they get in hospital, they all are Connaught in the work.
Yeah, not the main referral hospital that. But what
it's still the best in Sierra Leone. Even though we feel it's not the worst, so it dirty, it smell, it rubbish, nothing on the day, but it's still the best. All those private practices they make in a salon, and they say they're not good though. But in they eat you money, they can have the same consultants there. That in the back, they work at Connaught.
They don't have, no, they're not, they're not getting that. They go there for good and go see you, then they for refer you if a major issue to a proper facility. But
imagine the doctors there where they Connaught, where they run their own private hospital there, then in back they refer you to themselves.
Yeah. But you able for touch, if you touch Connaught Hospital, like they should put in a container, bring and can England. If we say that Connaught go be part of the NHS for let allow patient for go inside it.
Then go polish her inside 1 week, it go be part of.
That's then therefore make sure say they overhaul her. But as it is, you can't refer someone there. The hospital where you get yonder for one small thing, then they lock the hospital there. If you not meet certain standards, UK.
Me backyard surgery where I go see me doctor maybe once every 6 or 7 months. You can't make those comparisons. But we for be ashamed. We for seriously be ashamed.
This is why I do that. Now for the
majority of the people that will get way come out in this part of the world and they don't see the nature of the backyard surgery then way we get. Now we backyard them. We not to even a main hospital. Just the backyard surgery. The other day, I'm gonna be dentist. I can't even believe this now like a now says if you're an NHS patient for liquid yourself now easy. Because they don't so make things, the queue is so long for any kind of NHS treatment. The facility is there, but the queue is so long now that you're forced to go private. As somebody mentioned, the NHS still people in the left hand and go private. Not so because of they're not good, but because of the queue.
And the waiting because
the waiting list is long.
Yeah.
So if you get money, you just have to go private. Not so because you not get money for go paying at the NHS or the NHS not good. No, now because of the waiting list is long.
Mm-hmm.
But it's still available. If you work at going to an emergency unit like any big hospital, you will be treated instantly. NHS queue not the under. So people are waiting for that emergency call. Call the ambulance, go to the hospital, you'll be seen instantly. But you go to the hospital, you go see your doctor, you go see your surgery, you go see your GP, he prescribes, he make recommendation, he send you for a referral. You go to the big hospitals there, the referral will tell you, say, there's a queue for you for get transplant. There's a queue for get blood transfusion. The queue is about 6. I have been told to wait for a body scan queue for a year, and I should not travel. I'm like, hey, really? Well, I go there salon. But they go salon. This will sell salon 9 man, they take all their for so. Imagine, just because we want to go back home and deliver some of our expertise in few things that we know. I don't say we're not super professionals, but we just have to share some of those small knowledge. So they take all your medical risk and go salon. Not taking any form of insurance, taking nothing into consideration just because you want to go back home and give and contribute towards society. We took all sort of risk. Now the useful take make some of who come back so we did like out this whole. You man, smile when you smile. You know go talk nothing faster.
I won't say thing.
Don't say thing. If you say thing, fun will happen. But we therefore really look at what's the way forward? How can we move on with things we will make things a bit subtle for the people who not begin to think otherwise. But the priority should stand, and those priorities should be executed. How? We get for force people and for take positive actions towards their goals. We get for hold people responsible for their actions. We get for make sure, say, if you are asked to deliver anything within your community, deliver it. If government not pay you, God will pay you.
No.
Deliver. You know what I say? If you are, hold on a sec. If you are asked to deliver in your community, it means if then you work, say you na the man I have for hospital business. Tell them, say, this na the fund where I need for make this hospital business work. If they need that money, they deliver. If they not give that money, they not start the work. Because you start work where you not get for end. And now you get for be whole solely responsible for that work because you don't take them in the first place. Like we stop for take jobs the way we know for say we not go able for deliver because the facilities are not right, the structures are not there, the finance is not there, and the buck will stop on us because they've given us that task to execute. You cannot execute if you don't have the right tools. You cannot execute if you don't have the funds to make sure it happens. You cannot execute if you don't have the right structure in place. That's not the major thing of lackness alone. We go take things then. Oh no, this is a common thing. I do it for inside 1 week. It takes forever. It takes forever. Because you're not even sure of what you need, how you for do them, when you for do them, how you go deliver, and how long it will take. There is no plan, no structure. So let's start to rethink and see how we take up positions them of trust. Because every position of trust, that's alone, it entails a lot of work. Think about it before you say, yes, I want that. Not to, when all time it pleases the president, you for say, yes, sir. There are times when you say, President, sir, I honor I respect your appointment, but will I be able to have A, B, C, D for me to execute this job properly? If not, I won't be able to execute it because I don't have the right tools. I don't have the right structure. You need to give me more structures. You need to capacitate. Hi, Kola. Femi, dictionary. You need to capacitate my logistics so that I will be able to deliver this. Otherwise, I can't. No malice, no disrespect, Mr. President. I'm waiting for your call to satisfy and to work for you. We need to work in those sort of criteria so that we'll be able to deliver. Imagine you are supposed to gain employment, you've sent your CV and nobody responded to you, and you're expecting salary at the end of the month. Hello? Are you serious? You're really serious? These are some of the things that happen in Sierra Leone. We take things for granted. We assume, and we just take up offices thinking we should be paid because we've done one part of the criteria, so it means every form of the criteria has been completed. No.
But how you go occupy office in the first place? Who's a proper system there? Where they not employ you yet? Because employment is more than just giving you an acceptance letter in the first place. So that just shows say the system is flawed. For let you go occupy an office where you don't even receive a letter, even where you don't receive a letter. The onboarding process for let them bring you camp, for let you be a proper staff and what you call them. That's a whole different chapter, So what me they say, T-boy, I agree with what you they say. Oh, let people not work for less. But the only thing with me they say, where I disagree with you. If governments not pay you, God they pay you. I disagree. Now that make the thief bokuna the country.
No. And maybe not. Ego statement in the kind of
so I want to correct them because
in the kind of form we are put not in that kind of context. Sorry.
Okay. If government not pay you, ask them for let them pay you. Make noise for let them pay you. Yeah. So that's a low all no because until somebody computer don't jump in him, they go now that person pocket. So now salon are the only place where computer they jump post in a way come for in remuneration, in salary. You don't work for 6 months and say computer not jumping name, your name not appear on a scoreboard. Lord have mercy. Anyway, well, Fambule, we don't talk calm. This na medical, I'll talk about the healthcare and medical situation now. We country Sierra Leone. It's triggered by the conversation triggered by certain things that will happen most recently, but these are not new. We don't talk about them, and not just begin with them people and they happen, and they happen to isolated cases that we don't know. Right now, we see somebody go out there. I don't know if Femi, you still have that video that we can show? Okay, so we get a video, somebody go in a community where they talk about the same issues them. So one for there, we play that video, and some of them possibly don't see them, but we want to bring it live to you again, so for help the conversation, and we go round up to this program. Over to you, Femi.
Really need for put to priorities very straight. There is a reason why God give we life, give we brain and our aid. Give we brain for all we know, waiting good for we. Life, now one chance. You need die, you come back. Sierra Leone, the people who entrust our country for look out for we. No look feel say it necessary for provide sober healthcare. The unfortunate part is when you talk about these issues, some of we, if not for health no more, I'm all in for health. People when you talk about these issues, then see you like say you're not serious or you're not person we just want for put more by the administration. They fail to realize. Say when they go to hospital, then they go ask you whose party you support. When you go to the hospital, they don't want to know if Namada be you vote for, if you vote for Samuel Kamara. The same facility within a hospital for everybody, for everybody. When we go to hospital, then they go fill form say you na APC picking or you na SPP person. If the hospitals are not equipped, the same chances where you get for die, now the same chances the other person get for die. So it's not about politics. When they talk about health business, now for everybody. But Sierra Leoneans, when people talk about things the way they disturb the country, the next way they talk about politics, the next way they say, oh, you're against the administration. That's in there. It pain me. Because we have innocent people the way they die. People the way we say we need now this life. Everybody go for die, but untimely death they don't too plenty in the country. That's a way controllable. We don't even get sober emergency system. Forget about Freetown force. Imagine if people are dying like this in Freetown, where we say at least we remember say sometimes the accessibility to health, that rotten health all the most of. At least today. Think about that and think about them people that when in them villages they are they can't fend so. How they know accessibility sound like. People should take these things seriously. It can be you tomorrow. What do you go do if you grab with heart attack? What do you go do if your papa grab with heart attack? What do you go do if your brother grab, he gets attack, he get panic attack, he get anything? What do you go do if you picking get problem na net, you want wake for go make I solve them? Me wait Tinapia so I don't encounter so many problems during the health system. I lost me mama because of carelessness, negligence, and the fact say waiting the hospital for getting no get them. Sick way be safe na any country in this world, even not to even advance, local Ghana na ya, local maybe even Nigeria. The man no for be die. Now God na in the kill, but the people already they die in this country. Most of them dead. Trust me, they are untimely. My mom died because there was no oxygen. Imagine oxygen. And to think that I almost lost my child, me pikin almost die because waiting in need na Connaught, not been there. We been get for move and go na private hospital. Waiting in need na cottage or la jury, not been there. We get for move and a private hospital. I almost lost my child twice. Imagine say if I'm not be able to afford the health care we then get in that private hospital, if me picking up for don't die day like today. People should take these things seriously when it comes to health for taker. And this not time for ask. Listen, there is no right time. There is no right time because these people are sitting on millions. People that die, hospitals and day. You go for buy the new way they chook na US. You buy the glove where the nurse they use for clean you. You buy those things. Seriously, and we still accommodate down there. We know they talk people and keep mute and don't pay them mot them because they feel like say the system they favor them. Some of us we don't care about the system. If the system wants to favor me, if you want to favor me, as long as I get access to it, I don't say where I sick, where I go now hospital to get well body because nobody know the way one die. These people we are supporting, they have quality, they have access to quality health. From we money them, we taxes them all they pay. I didn't pull them, send them picking the overseas for checkup, send them welfare and they save for checkup. Some of them they don't even know how these hospitals are. We they go there every day. Now we they check, now we they go bed they know they enough. Now we they go admit you person, you no get space for lay down. You they go admit you picking a bed where be saying them 4 or 5 they lay down day. Me don't go admit be picking a cottage. 4, now them 4 then a bed. You the come gonna bench you they sit down. You just sit on a bench, you watch you picking, they take drip. You just sit on a bench, you drip fly by picking. You just sit on a bench, cockroach and arata, they can't cham your foot. You just sit on a bench, stay door clean. We don't see all anything in there. But people still they feel like say this is about politics. We life there, we don't take them, we don't so center politics into that. We die, we don't sign them. We not care if we live a good life, we not care what we deserve them give as long as the party will want and in our power. And this is the time because health is paramount. Nobody know for put health second to anything. Without health, you can never have a productive population. Imagine if all the young people in the country they die, the old one then they left because they are into politics. They are having money. The young one they die, would they fend for them picking them? Young people are losing their lives every day. Would they fend for their families them? We should take these things serious. And honestly, we need for really send a strong message, but we are not yet serious. We need for send a strong message say we need quality health. We need them, we demand them. We ask for them because it's our money, they have to give it to us. We deserve them. Now we own nothing what we want and we forget. You know, for even be like a luxury or privilege or an opportunity or something they do like for say and just they do a no more for do sake. They have to do it. But we have to be serious about it. All the other things they advocate for, yes, they're important. But there is no way you're able to advocate for any other thing if your health is not good. There's no way you're able to advocate for anything if the side way they go for go repair, you sells them. Side way you go lay down for let you get well body, they rotting and you not to side way you get faith in. Imagine say you go to the hospital with the thinking say maybe I go to this hospital and they come out alive. Imagine, Andy. Imagine say you they left you sick, your parents is sick. Me daddy right now say if you get cry at that. The next thing I remember, whose hospital I go time? What thing I go do? Because I don't even trust the hospitals anymore. You're afraid for care person go. Not to say we not get the professionals, but we can't go. What the professional go do if you not get the equipment for work? People have to take this, especially this one, serious. Please, Sierra Leoneans. Sierra Leoneans, we dey beg. This na for we all. Imagine how many families they lose people there every single day for things that we do not even deserve for die for. This is the way they don't deserve for die from. This is so heart-rending for some of us. Where we all held dearly, we know the value of well body. We know. Some of who don't lost family members then because of negligence, because of unavailability of the basic things then at the hospital. Basic things then at the hospital, and people don't even take these things seriously. We don't know what we deserve. We just they take a number for say one set of people that they enjoy, that they live their life, and we support them. We forget what we deserve as a country. We forget what we deserve as a population. We don't even know how for all them people they are accountable. All what we care about and party in a power. And when you open your mouth for talk, then begin label you. And for me, Adama Koroma, I don't care what label you put on my head. I don't care what label you put on my chest or on my back. I'm going to speak my mind. I don't care what label you put on my head. I don't care what label you put on my chest or on my back. I'm going to speak my mind.
Well, Fambulem, that's na Adama Kuruma in video, and it says it's all. I'm not being fortunate for watch or listen to them, but it's like it just summarizes everything we don't talk about now, yeah? It summarizes all the contributions that will call us then don't make Naya T-Boy. So waiting are you comment on the video so far?
The first time I watched the video,
oh, you been watching before?
Yes, I've been watching before, and I was shocked.
Yeah.
I was shocked to see a young lady expressing her frustration about the medical health system. I believe she's a nurse or junior doctor.
Yeah, it must get some healthcare background because
because I think they're the one way they're going to the provincial towns them for deliver some kind of medical facilities to the people in the villages. Mm-hmm. So basically, in concern to me, now the fact say we are taking things for granted, we are politicizing things, as people then always say, as you say something, so it's either political or it's not. And it is another concern, say, if we stress about the health facility in Freetown, what about the villages?
We're non-existent, not even there.
Thank you. Mm-hmm. What about those areas? Last week we get this lady asked with me, they ask, say, how do you get to the villages to deliver some of these messages they really go deliver to people?
Okay, that Florence.
Yes. Mm-hmm. So basically it was a challenge, but she does. It's in a foot soldier in there on the road. So basically, if a nurse or a medical practitioner when at this lady, where they go to the provincial areas then and they go deliver in services and it raise this kind of concern, don't forget say it might be you tomorrow. They for on a one man remote. Not take but the look being gone.
You're not a friend.
Not say if I be no scenarios and they don't happen plenty of times and people and they still neglect them scenarios and they say, it not happen to me, bro. Not possible self. Certain thing and they will, if it not happen to you, you don't know the magnitude of the in particular thing and they not ever wish that for happen to you. But for the fact you need ever wish that for happen to you, don't sit back and don't say nothing when something happened to somebody. We're not facing that the right thing for happen to somebody.
Right.
We get to look at the seriousness of this issue. Look on our way to make it get to the extreme, make it escalate. Now they say Corona might be a big hit for the third wave in African countries.
Mm-hmm.
I don't know whether the authentic WHO website or program or some kind of information will go out. We highlight Sierra Leone as one of the countries that will be seriously hit. Mm-hmm. And at the moment, they say the corona cases is extremely high. I don't know how true that is. No, go back to the square one scenario we've been get with Ebola. We all know the kind of devastating thing we happen during Ebola. I was there. Nobody can tell me. and that na the evil that you don't see. Ebola was many million times better because you can see the symptoms of people who are suffering from Ebola. COVID, you really can't see the symptoms. You can only hear and somebody can express it to you. COVID is possibly likely very closely similar to malaria. Similar kind of symptoms. So if we don't be careful, if he actually come out, like how they say, touch wood, Papa God, push them far from we country. Push them far, like how you don't contain them. So for all this period of time, continue for make sure say, it really exists in our country. If Astagfirullah, that kind of crisis day, I don't feel to say it will go down well. Again, the concern will make a facing in the raise this now because most African countries are very close to the raining season. And we now know the impacts of COVID during winter. So maybe they are making those assumptions because it is going to be rains in Sierra Leone and some other parts of West Africa, per se, which means the weather condition is going to change. The climate is going to change. The temperature is going to change. It's not going to be the same. It's not going to be hot as it always used to be. And then they say, well, kind of in a way, COVID not too comfortable with heat. Nobody knows that's whether it's fact or that's not true because Spain really gets the highest or the hottest climate in Europe suffer the worst during COVID. So we cannot justify whether that is fact. But again, these are the Western cultures and they're not too comfortable with malaria symptoms. So basically, if COVID is an extreme form of malaria symptoms, we don't see few of those comparisons, we might not say whether it is or it isn't, but it gets in your own interpretation of how they look at the symptoms then. So we might not think it is of any serious in terms of the impacts we will create in Africa, but they got push and far for me. Like it just be cinema and just the assumption of the WHO people then just they assume. Like how them be always done, they assume initially when COVID exploded all over the world, they thought it would be a devastating crisis for African countries, and it wasn't. We hope and pray it remains the same. But we really get to look at all the things that also people there of concern, they raise with this alone in terms of the health sector. We've been talking about this years back. We've been talking about this months and months ago. We still continue to talk about them. And if anything come up, come up, I think we get subsequent programs they would line up or deal with these issues head on and try for we able to reach out to the right people and now really in charge. This time around, we will publicly publish those letters if they refuse to acknowledge them. Because I think we are tired of saying this all the time on our platform. We make sure we reach out. We said they do the social media platform thing where we broadcast with letter. It pleases Sierra Leone Media to invite the Minister of Health, to invite the Deputy Minister of Health to come on our platform and talk about the serious issues of concern within the health sector in Sierra Leone. It pleases us to invite the director, for being responsible.
The CMO, the Chief Medical Officer.
The Chief Medical the Chief Medical Officer. I'm serious about this, because it's not a joke anymore. It is not something that we should be laughing about anymore because it is serious.
Me, I go even do live TikTok with the what you call her.
True, seriously, not joke. We have to start to do things like this so people know that we are reaching out. Because we don't really reach out behind the scenes and nobody is acknowledging nothing that we are sending to all those different ministries.
They begin to do TikTok with the letter.
We definitely have to do something that is going to be blatant. And let the people know that we want you to come and talk to us. It is your responsibility to talk to your nation, to tell them about the states and why things are going wrong. Put the blame on anything, but tell us what is the blame. Tell us what is the matter. Tell us why we are failing. Tell us why we have issues that we cannot solve. Tell us where we are going wrong and how we can fix it. Tell us what the problem is. And then we can now sit and see how best can we resolve. But if we don't know what the problem or where the problem is coming from, how do you want us to solve it? Not a magic. You can't fix what is not broken. But what is broken? You are saying nothing is broken, but we can see the structure is not working. We can see the infrastructure is broken, and you are telling us it is not broken. How? Now, magic? I beg. Let her close up with me point and me stuff where I see now one movie when I just the exact interpretation of what he talks to. We didn't know our standards. There seems to be no expectation to go above, beyond what one might know or might want to know. It seems people are blissful in their own ignorance. How far have we fallen? Indeed, how far have we fallen? Are we living in an environment where people are blind? What you don't see, you don't know. Out of sight, out of mind. So now, ignorance is the new norm. In fact, ignorance is the new excellence. The less you know, the more simile you gain, just in case you need to be smart. There is nothing to be smart about. When I listen to that, nothing comes in mind except Sierra Leone. Because it's just exactly the way of life of how we're living in Sierra Leone. I will end my own program there for tonight. And let us just think of the way forward and how we get a better nation in terms of the healthcare, which is a prime. Because if you don't have a good health, you don't have a good nation. So let's try and fix it. Otherwise, we will not develop anything.
Right.
Because the system relies on the healthy nation for it to grow. So please, let's put our hearts together and be patriotic Sierra Leoneans and forget about our divisional divides that we have and the ones that we have created. Doesn't work for us all as Sierra Leoneans. Thank you.
Gracias, Senior T-Boy. La pasuna over to the man himself, Obafemi Amilcar Palmer. When said close for
me. Amilcar name for put fet Palmer there, or not just left on also.
Yeah, of course, I can put Palmer there. Oh, fet Palmer?
Fight Palmer.
Okay.
And then they go no more, so without fights in the middle.
Okay.
All right.
Over to you, Femi, and then we'll round up.
So I can't close without saying, Juma, can you hear me?
Loud and clear, Mr. Palmer.
So yeah, wow, what a good show.
Kunku, before you begin close, because Kunku say
yes,
it is le Ami no come bulldozer. So it's over you right now because of the smooth voice.
Okay, so it's been a beautiful show. I'm smiling. We're laughing, we're joking, but we're not happy. We vex, bad one. You know, how long will it go through the entire song? Usem the change go come. Usem this Messiah go come, we go can save we. But before I go under, I want to tell you a few things to him. So when I talk about insurance earlier on, I don't remember that began come up. But if you think say if we all left here so go salon, for go walk, for go holiday, or you tap in a salon, or you not even the top elite people in a salon, you get money, you get money pass and sand in a beach. Emergency meets you, and that emergency they say you no go able reach the nearest evacuation plane. Then get for treating a salon. Only then will you really and truly understand the problem with the poor man in the face. If we fix the country for everybody, that means to say we fix them for we safe. Because I sure say we all know gentry people them we been there in dire needs and not be able for be evacuated out. We know holiday maker that we go holiday na tongue. They get return ticket. Sick meets then they didn't come back. So it's all our responsibility. I talk earlier on say sometimes we they send money, we they contribute to the problem. People are going to say yes to me, they talk about cool crap because we're not going to let for people and me then die. You're too right. But we governments them don't always above per we for build them out. This is a sickness where Africa gets, not to just Sierra Leone. A sickness where Africa gets. The diasporans them, we work hard for a living. We know they go lunch then go sit on a beach. We know they drive go up Plumley Beach to go sit down after work. We toil and toil and toil. And when the call come, we oblige, we send. I wonder almost Western Union go see with the Sengo Salon or MoneyGram. Before I talk now, all the other salon places that we send money. I wonder how many pounds, how many dollars, and how many euros, and how many Australian dollars that we send for help, support with people then. Then day to day feeding, the house rent, then school fee, and definitely the hospital bills them. That medical lady we been talking in that village, Adam, I think her name was.
Yeah, Adam.
He talk about, he get for sit on a chair, all net was 4 pikin laid on a bed where they need treating pikin. T-boy talk and just know. T-boy talk say he been sit down where in Bobo they get drip, middle net, dark room. Really and truly, when will things change? When will things change? Cottage Hospital, myself born. I believe say things went great then. But guess what? I believe say they were lots better than they are today. I know a doctor will save me life. As a toddler. I wasn't even a toddler, I was a baby. My papa come out, camp, middle nets. He can't meet me, my mama, they pace up and down. The way family done. My mama feel to say that was it. My papa take me. T-boy sabi that story there. Daddy don't detail him. He puts me in chest all night. He puts me in chest. As morning cancel, he gonna me go to doctor. Yeah, I don't forget the doctor anymore. They talk so. God bless his soul, because he don't pass. He came me go to doctor. And then doctor say, hey, the boy so. He look me nice, yeah. It is a finger. Then he say yes. Then he give me worms tablets. And say if you see the worm, they will pull. But people that we know their work. When I talk say Connaught Hospital is a better hospital than the ulnar salon. Me I not go talk so. It might be true, it might not be. But what I know, a lot of the newer hospital them seem for they employ a lot of people and we not get a lot of experience. It might be good. There might be people who are willing to learn, are keen to learn. And it's like say, from which I see, Connaught Hospital gets all the veterans them. So something I make una they say Connaught better. But beat Connaught, beat any hospital in the district them, beat any hospital in Freetown, we ask the people who are responsible. And I only go, let's go to the top, right to the top. Mr. President, the Minister of Health, in deputy them, the Chief Medical Officer, in deputy them, the consultants, the doctors, the hospital administrator, Even that person with the sweep na the hospital, we they ask all for do una work them. They interviewed a woman working in NASA. She was the janitor. And then they ask and say, "What you do na this project?" Now I say, "In the help for put a man on the moon." This was in the 60s. You know what I mean? That means that person with the sweep Connaught Hospital is just as important as the surgeon. Anyway, in a film about Sierra Leone was done about maybe 20 years ago or something, Norwich, Blood Diamonds. They're not able to film the inside salon.
Yep.
They had to go ability in South Africa, then go film there. It was based around the war in Sierra Leone. Then talk some of the language then they. But I no go believe say they not act one piece of that film in a salon. You know why? We've been get privy to some of the top people where they work na that sets day. Then tell we say the insurance company would not allow them to go to Sierra Leone because should any emergency happen, any medical emergency happen, Sierra Leone is not equipped to deal with it.
Yeah.
This was, Blood Diamonds. Check when the film was released. So just add maybe 2 or 3 years before we make the film. Then you know how long ago that was. In 30 days within Naya, so we talk the same talk. So 20 years ago, if we not put the things in place, sometime by now, things could be different. But every new administration we come, they want blame with Pintradi. Let's fix today so that tomorrow we go see we're getting there. My last words for you guys today.
Yeah.
In life, we need to make decisions on what we want to do. After we don't decide what we want to do, we need to take actions, put actions in place. And we don't do that, they don't. We can sit back and wait for the results then for come. So decision, action, results. Now then skit here and there, now no the thing left for now it's them. But the last word them now, we should challenge the rule book. The rule book will say salon no go better. We for challenge dandy. Especially if we're in a position of authority. If we get people with the over, we will try for mass, we and not allow the changes for B. It's our responsibility to raise our voices and challenge them. Let's challenge and change the rule book. Let us not forget to see the position that we do. With the rights, we story them. Rights now, what will they do? So with the rights, we story. Somebody someday is going to tell the story about Tweeting T-Boy, Juma, and Femi Bini talk about in 2020 and 2021. President Bill, the rights in story. The chief medical officer, the rights in story. We're writing the stories of our lives. Let's make sure that we're writing what we'd like people to read back to us in our old age.
Thank you, Mr. Obafemi Amil Kapama, and thank you to T-Boy. And also thank you to Adam Akoma for where you give an opportunity for use your video. We appreciate you very much. You spoke, well, and you talk and advocate for the people of Sierra Leone. Like what you say, the one print to me again, I'm in mind with your video where you did now, where you ask, say, imagine if it's you. Imagine if not you. So now that one day, now I left with on Adama. On all the callers that we say thank you very much for the calls them and the contribution and the chat groups, both on Facebook and YouTube. And, we don't get... If when I watch, this is not a pre-planned program. We challenged each other here. We disagree for agree, but we all talk the same thing, but we want them differently, or we believe, say, it will be done different ways. But the bottom line is we want the best for Sierra Leone, and we want to see an improved medical and healthcare system we go cater for every Sierra Leonean, not to just for the chosen few. Don't get upset if you're in government. All you can do right now is do right by the people of Sierra Leone. All the book where you go learn, Mr. Chief Medical Officer, it means nothing if you need to put into practice. Yes, we say we blame the president. Definitely the buck stop with him. I stand by that. That will not change until things then change, because waiting they make Nigeria for go campaign back, say I've been do this, because he use them for criticizing predecessors, then say they not do nothing, and in get the wherewithal. That's my favorite line. He sat on BBC on so many occasions, say get the strategy, get the mathematics for solve the problem then at the country. And in not a new man at the game, he was there before. He'd been tried and tested. He don't go study, he don't come. So if you see the people in your administration, in your government, not doing what is right, we expect you to step up and make sure you replace it. If you want, you put all your family members there, we don't care. You can put your brother, sister, uncle, that we don't care who that you put there, as long as they can then deliver with the benefit. Like I say, when I go to hospital, then they go ask me, where you party card? Are you APC or SLPP? Whose tribe you belong to? Whose part you come out? No. Then they ask, whose part you seek? Yes, waiting they do, waiting they ask you this, that, and that, and they ask me. So if you want, you put all your family members in, they may not care. Just make sure they do the right thing. If they're not doing it, you will blame as well. I see all man start with quotation and talk about things there. Mr. Get one where the ib. And me where the ib, I just want to encourage we already talk and salute everybody in our different social media platforms and like we own them, people where they do audio, and even mainstream media where they highlight issues then in Sierra Leone. We know it is challenging. It's easy for us to say here, oh yeah, possibly if I've been in a tongue, Mr. Ben go turn mumu. So the one that we're able to grab and talk, we appreciate Tuna. So tomorrow we then with the three banner boy them, Ibrahim Fona, Cashbox, and Comrade Koita. Then the day we can talk about a range of issues on public opinion, and Una say will get an opportunity for calling, because Una see the issues, they're not isolated. They are not. They talk about healthcare now, but you see the different issues that were mentioned. T-Boy talk about, education, talk about different things. And because there is no way you can talk about healthcare system, you not touch on their other issues. And it shows that everything is important. But how we go about it, now the most important thing for make sure we achieve the goal. T-Boy, they talk about crisis. Me say they help for pray. Papa God, yeah. Sorry for we. COVID business not reach that country there. Because when you talk so, the last health crisis we witnessed in Sierra Leone was in 1994, I think 94-95. Cholera. I know they ever forget that. But they try for go Guinea, then rebel. Imagine cholera during war time in Sierra Leone. So they block the road, so the vehicle over travel go with not able to go. Say, okay, look, can't wait. And we don't want to return home. We say, look, just wait, because transport, they have to forget. So the guy say, okay, when I go sleep now with family host now Wellington. I don't even remember the place where I was sleep. But T-Boy, that night, we were there, all the children in our house, whoa, yo, he don't die, yo, this, that. On arrest. By the next 30 minutes, another house waiting. He don't die, yo. Mami Yebusef don't die, yo. Did that cholera.
They call
cholera. I know they ever forget that health crisis day, and I know they pray anything like that happen in Salon. Those who were there during Ebola, then get recent memory of things. So now, like a T-Boy, then T-Boy, they was with Solvata all.
I never see Solvata. I don't agree. I called Femi. I said, Femi, what's not called Femi? I said, Femi, you don't eat what? You say, what's in? I said, they say for what to solve at 3 o'clock in the morning. I said, me, I don't Chris.
Yeah, people in don't come when nowhere close. It can't team up, get big cup. Nina butter cups and I be taking the bill you are trying to make in Jesus' name.
Me, when they first got to me, say, Tiba, you the was, and I say that.
You know.
I tell me, I mean, so I say, and make sure nobody knows that this also. I grab us, nobody knows. I don't agree.
So, things like that, we try for make them a little bit fun, let it not be too tense for people, because these are not things that are good. Sometimes when we finish our programs, we go sleep. The short sleep, we get 1 or 2 hours, we get nightmares, we're not able to sleep. Some of the conversation, and this is the truth, So we know one for discuss sad things about Sierra Leone. But one thing we're going to encourage people, don't stop talking, don't be scared. And Mr. Bengo left now with these small statements where I pick some side where I say relevant, but I don't know that are the author, but it go like this. Because we quick for say, but what you go do na salon? Alexa for talk will do nothing again for commodity above case. No. Like Femi say, we are writing our history with a build we own story, other people then they do their own as well. So I go left for now with this way say, why fight what seems to be a losing battle? That's the question. Because evil cannot ultimately win unless we all stand down and allow it to win. That is why evil always puts up the illusion of winning. It does that to demoralize us and make us give up. Never give up, my friends. We have the right and the truth on our side. So that's why we have to talk. Because the truth now in the last and in August surname, and we day by that truth, they will get the truth. Now we said one day, the truth shall set us free. Until tomorrow, on behalf of the Sierra Media team, me Juma Bade say, Tata.
Juma, before we go, I want make a competition. T-Boy make T-shirts for anybody who get this right, including you, Juma, and even yourself, T-Boy. I talked before. I said there was a song in the 80s where a popular Sierra Leone musician sing. We say, if life was a thing that money could buy, the rich would live and the poor would die.
So you want for another singer?
I want for another singer. So challenge to all reviewers. Something tomorrow I will give the answer. And
sing the rhythm. Sing the rhythm of the
no,
song.
you know, so I don't get good voice for singing.
No, not only the voice. I just think.
If life was a thing that money could buy, the rich would live and the poor would die. Salomon Singam in the 80s.
This Salon?
It been popular. Yes, our Salon had been there at the time. It been popular in that song. So it been popular at free song. Me cannot sing a Salon because in Sion Semi na free song bobo. A free song in the 80s have been the free song.
Well, you waited till late, Remy. So what you need for do now for bring and come up again to my earlier in the show, so at least we have a couple of hours.
Okay.
So una way there.
Una get advantage.
Yeah, they don't give una leakage now. Now open book. So
if money was a thing,
your special T-shirt.
Yes. So Tiba forget the T-shirt. So the T-shirt forget the quotes they back.
Yes.
If money was a thing that if life was a thing that money could buy, the rich would live and the poor would die.
Yeah.
And sometimes we try to forget the artist.
Okay. That would be nice.
I'm not sure.
Thank you so much.
Sometimes somebody will get the answer.
The answer, all right. Well, on a day before tomorrow, we continue that competition day, and you get a T-shirt where Mr. T-Boy the design custom-made T-shirt from Sierra Media. And by the way, I don't know a lot about Sierra Media, but we'll have to do a special program on what Sierra Media is made of. Sierra Media and T-Boy's production. Because when I get for know what they do, what they don't do, and hopefully when I go patronize with services there as well. Once more, on behalf of the team, for Unawede Facebook and YouTube, we say Tata and thank you so much. God bless you. Oh, T-Boy.
I just want for raise awareness of the Gorama storm disaster project. Say the YouTube, the GoFundMe don't raise about £400, and the money paid into the accounts don't raise about £225. So at current state, we're looking at £625 so far we don't raise. We still they ask for people in donation as we don't push the deadline to the mid of this month. But unfortunately, right now, we still don't begin to encounter some of the concerns then we've been raised earlier on. Say most of these houses built in my village are mud houses, and for the fact they don't get roof, some of them don't begin collapse. So it is getting very serious because the rains are getting very heavy nowadays. And if we continue for Lefam for make it go for more longer period, it means more disaster they unfold. So we get for donate as quickly as possible as we can. So Global for Reach, we target £5,000. So Global for at least begin solve some of the problems then we this particular storm disaster don't cause Nakangama. Yeah. So look, we not forget for still go na the page, the GoFundMe still there.
People they ask, like pin the page there. And so people will continue for donate and all that. While T-Boy, they do that, I just want to remind you, thank you so much for that update, T-Boy. What in T-Boy, they talk about, we did a special program here for a particular place now, Connaught, we then call Kangama Gorama, chiefdom, where happens for B, T-Boy's chiefdom, and by, extension, we self now, we own Connaught village down there. So if you ask me if me a Connaught man, yes. I am a Connaught man. I have a village, na Kangama Gorama, same as Femi Pama. Femi Pama is actually, being initiated in the one level above me, and, yanda. So if we go by rights, na Femi first, then they give side for Sidom and water for drink before they give me. So then we get a, heavy storm. We affect about 884 homes. About 500 people, including community facilities like the school, the library, or and the church, and some other facilities. And certain people and they will be get injured. We them get for taking hospital because either a block for them pandem or some kind tick for them pandem. So we launch a program for raise funds for help them people and they because up until now I don't know, but up until now, and obviously the national disaster team don't reach the age for go look at them people. Because if they say the host then don't begin for them, the very things they will be afraid is happening now. We're not sure say they still don't go there. So this is being treated as an isolated case, but we came to understand that similar situation happened somewhere in Koinadugu Kabala district, Koinadugu district na Kabala. So things then they happen where we talk about when people and they neglect them. We don't want that to happen. So if whatever you're able to do to help those people in need, please do so. The contribution continues. We don't pin the link, the GoFundMe link. Or if you want to donate in another way, you can contact Sierra Gem Media and we'll link you to T-Boy and wherever you are. Then we'll link on out the people where you will able for contribute, and we'll definitely give you updates. And at some point, we will get our actual live program again. Forget, they link them from, the particular place we're affected for can give you a real-time updates now. So I don't know, do you guys have anything else to add or? Okay, so if not, like I said, tomorrow then also with the Frio cash box, Ibrahim Fona and Comrade Koita, we can discuss a wide range of issues them we concern Mama Salon. We know the talk we get right now and nobody know the stop we because truth day now we side. Until tomorrow, good night and God bless you all. Stay safe and stay blessed.
The total population of Sierra Leone in 2019 was stated approximately at 7.8 million. And the most common cancer reported in 2018 was breast cancer, with an incidence rate of 25.1% and a mortality rate of 19.2%. Ward 2 at the Connaught Hospital, Freetown, is a female surgical ward that cares for patients requiring breast surgery, chemotherapy, and palliative care. General surgery also admits to the ward
as see fit. The ward is in need of a significant refurbishment and has a major impact on patient assessment and delivery of treatment, dignity, comfort, and infection control measures. The current ward area presents a significant challenge to infection control. There is no fit for purpose or adequate personal hygiene facilities. The showers and sanitary areas are in poor condition and are difficult to clean. The flooring is deteriorated. Overall deco and fabric of the walls need repair and full decoration. Furniture, cupboards, and shelving require replacement. The sluice, known to be the dirty utility room, is in poor condition and needs replacing. Windows need to be replaced as current windows bring in draughts, dust, debris, mosquitoes, and rodents. There is no designated area to provide a day service for patients receiving chemotherapy. Medical supplies is desperately needed. Therefore, we need a total amount of £15,000, which is equivalent to 195 million for this project. This project will focus on women diagnosed with breast cancer and other non-malignant breast abnormalities requiring one or more of the treatment modalities that are currently available. We will also set up a day unit for the administration of chemotherapy and provide training and development to ensure sustainability. Therefore, I am pleading to all individuals, organizations, and local businesses, and every Sierra Leonean and friends of Sierra Leone to make a meaningful contribution that will never go in vain. Ways to contribute will be seen at the end of this clip. I am Aissata Cissé Jallow of the Health Show Partnership Program. Remember, your health is your wealth.
When I was young, a lot of things were different. Unfortunately, most of the differences seen now are heartbreaking and are not good at all.
Before now, men were strong protectors of the weak, fathers, brothers, lovers, sons. Their mere presence guaranteed the safety of women and children.
But what do we do now? Men harassing and raping women.
Men sexually abuse little girls.
Men battering and killing their wives.
Any form of sexual assault, be it rape, sexual abuse, or pedophilia, is a killer to human self-esteem.
Women should stop dying in silence. Speak now.
The rapist should be stigmatized, not the victim.
I think death sentence should be the consequence of such terrible act.
And you mothers, build confidence in your children, put trust in them, listen to them when they make reports, and take necessary actions.
Talking of mothers before now, women were virtuous.
They were mothers, daughters, and sisters.
Nurturing, counseling, supporting their men folks.
But now,
women are trafficking female children for money. Women are forced to be silent.
All this must stop, and it must stop now.
Real men do not abuse, rape, or molest women and children. It is barbaric, unacceptable.
Let all real men stand with us.
Together, let's say an emphatic no to rape, sexual abuse, pedophilia, and domestic violence.
Nina Yvonne Akisoya, and 11th May 2021 make me 3 years where I don't day in office. I say let I come and tell Fritonians them Una boku boku tenki for where una elect me and una give me this mandate for serve una. But I not just want to tell una thank you for when I elect me. I want to tell una thank you for when I don't work with me and work with the councillors, work with the staff of Freetown City Council, work with so many stakeholders, including the central government, the international partners, the local partners. I want to tell una, the Freetonians, and thank you, but I want to tell all the other groups and the boku boku tenki. Together, we embark on a journey for Transform Freetown, and in nobody not been say it go easy. We published the plan in January 2019. And then in January 2020, we published our first year report. And then in January 2021, we don't publish with 2-year report. Inside the reports and day, you go able for read in much more detail, waiting we don't achieve. But family them, I still just share today some of the things that really make me heart gladdy pan this walk here. One thing we're really glad about, now the wastewater treatment plant where we don't build na King Tom. This is the first time ever in the history of Salone for let we get the thing they will come on with toilet. Instead of it just gonna grow na King Tom, it actually go into a plant where they get for separate the solid from the liquid and get for treat them and waiting for Connaught can go towards manure. It can now be safely, the liquid can now safely be disposed into the waterways. Another practical thing we are so glad for. Now this urban farming project, we bring over 300, in fact we start with 300, now we add another 200 women them. We now at them backyard them and in community level, particularly in deprived communities.
And they can create this, where you give, the okra they come up, they will plant them.
The women they do farming projects where go benefit them picking them for get more nutritious food, but it go also help them for get small thing at the hand as they sell them in the market. And then their nursery school. Family then go no say we've been done open the one at Congo Water Market for make vulnerable women them and then young picking them under the age of 5 get free quality preschool care. And now we dip and build the second one. We do refurbishment upstairs in the Croton Road Market, and that facility will be open and available to women and men traders inside Croton Road Market. Tricycles. Well, then tricycle and they not only then they help for keep we city clean, they also they create employment. We don't create so far over 1,200 jobs with young people then where they go and collect dirty na the streets. And now we get 90 more where they come on stream. So I'm so happy because it increased the capacity for collect dirty. At the same time, it increased the number of people them, young people that we get work. Let not talk and not talk about the transfer station when I did the dirty then they go. So we don't get 4 additional ones, including the one at Lumley, the one at Approved School, the one at Shell, and the one at Allentown. Bele Uman them. Then they all over with community. That journey for going to PCMH, it can challenge Bako of them. So we did work for upgrade 5 of we PHUs them for make them be monk, side with side Bele Uman, they able for born. Freetown people them, boku people that know say dog na challenge na this city. And so we don't start a program for sterilize, vaccinate the dogs them so that we go get control over dogs and we the ambog motaman, but we the ambog themselves. We go make we city healthier and it go reduce the risk for let people then get us sick with and call rabies. I don't share small about wait we don't do and over these 3 years, but I just touch the Tinem Boku. I go say anybody who wants for no more, also go now with Facebook page. We get Freetown City Council Facebook page. We also get Yvonne Akisoya, Mayor of Freetown. You go able for follow we. Let we continue for work together with all we stakeholders for let collectively we transform Freetown. Una, thank you and God bless you.
Yes, this na term for all Salone people and them party them. Sierra Leone Media will be bringing you a variety of programs ranging from documentaries to discussions, interviews, news, views, sports, and entertainment. programs will contain matters on development, governance, the economy, and issues that are of importance to Sierra Leone. So, no left BNO because we get Bebe program then like salon discussion, meets the ministers, the president's hour and the Gladi program. Look me, I look you. All this they start soon na www.sarahgemmedia.org. Now who's term these? Somebody